Deputy Miller.
Thank you, ma'am. May I make a suggestion? As you pointed out yourself when the last time you presided at our last sitting, Christmas is coming very soon, and I would like to suggest, sorry, I've just run upstairs. I would like to suggest that the next time, and in all future occasions, that anyone refers to you as Sir, they also make a donation to the charitable pot.
Is that proposition seconded? Thank you, Deputy Miller. Of course, it's up to members because it's not in standing orders, but if they're feeling generous, then I'm sure every donation to that important fund will be welcomed by the Deputy Greffier. We move on. The next amendment listed in the running order for the government plan debate is Amendment 16, multi-morbidity GP consultations lodged by Deputy Southern. The main respondents are the Minister for Health and Social Services and the Minister for Social Security. And I ask the Greffier to read the amendment.
Page 2, paragraph C. After the words Appendix 2, Summary Table 3 to the report, insert the words, except that a new line should be inserted in Summary Table 3 to include a transfer of £6.5 million from the Health Insurance Fund to the Consolidated Fund to allocate funds for the provision of a scheme to allow islanders with multi-morbidity to receive GP consultations or other primary health interventions at a reduced rate of patient co-payment. Page 2, paragraph E. After the words Appendix 2, Summary Tables 5, 1 and 2 of the report, insert the words, except that in Summary Table 5.1, the head of expenditure for health and community services should be increased by £6.5 million to allocate funds for the provision of a scheme to allow islanders with multi-morbidity to receive GP consultations or other primary health interventions at a reduced rate of patient co-payment.
Deputy Southern.
Thank you, Ma'am. He said very carefully. That happens to be true. It's easy to break. Anyway, right. Following the adoption by the states of P25 of 2019, as amended, the states has overseen the establishment of the Health Access Scheme, HASS, which has enabled affordable access to primary health care by some 11,000 of those on the lowest incomes and eligible for income support since January 2001. So the success of the scheme in reducing patient co-payments from £50 or more to £12 removes one of the barriers, the vital barriers, to patients seeking early diagnosis and treatment, and possibly adopting healthier lifestyles earlier. Members will recall that P25 identified 3 groups who would benefit from reduced co-payments, namely those who are economically, clinically, or socially vulnerable. This amendment seeks to extend the range of the current health access scheme in order to give affordable access for primary care to certain patients who are in clinical need, in a similar manner to the way that economic need can be easily focused on, and without the need for extensive means testing, using the income support criteria. So we need to focus sharply on who has the greatest clinical need for support. Fortunately, this focus is already built into our primary care delivery system through the General Practitioner Central Server, GPCS, a record of morbidity. So we know who's got multiple morbidity. We can identify that through GP's records, and that makes sorting out who might best benefit from reduced co-payments, makes it easier. And why? Studies have shown that people with multiple chronic conditions, those with a multi-morbidity, typically suffer a lower quality of life, have more frequent and lengthy hospital admissions, and may be more likely to die prematurely than those who do not have multi-morbidity. The latest multimorbidity report of 2021 assesses the burden of multimorbidity experienced by Jersey's population. It summarises the prevalence of certain long-term conditions amongst Jersey residents as recorded by GPs. The analysis shows the prevalence of patients with more than one of these conditions and which diseases are most commonly occurring. There are 12 long-term conditions which form the basis of multimorbidity analysis presented. These 12 morbidities are atrial fibrillation, stop me if I get these wrong, diabetes, asthma, coronary heart disease, chronic kidney disease, chronic obstructive pulmonary disease, stroke and transient ischemic attack, heart failure, hypertension, mental health problems, obesity, and dementia. Going down that list reveals some 31,000 individuals who had at least one of the 12 long-term conditions at the end of 21. 18,000 plus individuals had single long-term condition. 12,900 individuals had two or more long-term conditions, which means that some 12% of Jersey's overall population were living with multiple morbidities. And these are the people who, if they get treatment and assistance and support in the community, won't be visiting the island's hospital beds, we hope. This is all part, this fits into the new philosophy which says keep people out of hospital if you possibly can and make sure you get treatment to them in the community. And if you go down the list, you can see that 7,000 plus individuals had two conditions, equivalent to 7% of the population. 3,500 individuals had three conditions, or approximately 3% of the population, and 1,865, nearly 2,000 individuals had four or more conditions, equivalent to 2% of the population. And you'll notice that the older you get, the more prone you are to having one of these morbidities. That's the reality. But what that enables us, since we've got the record of morbidity, we don't need to rely on age as one of the vectors to approximate who's in greatest need. Because we know that, because the GPs check them out. An individual with multimorbidities is likely to require regular, if not frequent, visits to their GP to address their complex health needs. Furthermore, a GP will have a key role in managing the health of individuals with multimorbidities. The ongoing financial burden of numerous GP visits can only serve to cause additional anxiety in an already stressful situation. The fact is that today, there are already many individuals who put off seeing their GP or simply refuse to seek treatment because of the cost. This undoubtedly results in higher treatment costs in the longer term as symptoms go untreated, diagnosis is delayed, and the likelihood of hospital treatments increases. It is to be noted, the report on multimorbidity states, studies show that people with multiple chronic conditions, those with multiple morbidity, typically suffer a lower quality of life and have more frequent and lengthy hospital admissions and may be more likely to die prematurely than those who do not have multimorbidity. This amendment not only alleviates the financial burden on individuals suffering with multimorbidity by allowing access to GPs at a reduced rate, but it will also minimise the burden on our healthcare system in the long term by increasing the early intervention of GPs, the primary carers, thereby decreasing the amount of hospital-based secondary and tertiary care required. This proposition suggests that attention should be focused on those with two or more morbidities, which in effect is usually those who are over 65. And to finish, it's very difficult to put a figure on the cost to the states of capitation and quality payments. How many suffering from multimorbidity? And it's particularly difficult because the way that the Social Security, Health and Social Security Department actually maintains its records. You've got direct consultations and cases, which seem to be different. But nonetheless, what I'm proposing with that sort of pickup rate would be that on an average 9 visits a year gives a cost of the order of £6.5 million. Thank you, sir. Thank you, Mum. And I was doing so well.
Is the amendment seconded?
Yes,
Does anyone want to speak on the 16th amendment? Deputy Miller.
Thank you, Ma'am. Thank you. Ma'am, while I completely understand Deputy Southern's reasons in bringing forward this amendment, and I understand the thinking behind it, I unfortunately do feel I have to oppose it, and Council Ministers have opposed it, as you'll see from the comments provided. There's no doubt that action needs to be taken to create a sustainable healthcare system in Jersey, and we've discussed this at length already this morning. Primary care is a vital part of our overall healthcare system, and we must make sure that everyone can access the primary care they need when they need it. Although, as I've said this morning, primary care covers a very wide range of disciplines and scope, and we must think beyond purely visits to the GP. We also know that the cost of healthcare will rise in coming years, and we need to plan to meet those increasing costs. Again, I talked this morning about the demographics that show the increase in numbers of over 85s and over 95s. Our system, which has been in place since 1967 for primary care, is in need of review. It really needs review very badly, I think, and that review is already happening and is underway in the hands of the Health Minister, who's undertaking a major review of healthcare funding, and that review includes the use of patient fees in our healthcare system and in primary care in particular. This time next year, we will know the outcome of that review and we'll be able to make informed decisions. I feel it is much too soon to make decisions about extending access to primary care this year until we've seen that review. I have also committed in my ministerial plan to a full review of all our benefits to look at what our benefits are, where the gaps are, what our benefits are, how they're working, what are our known issues and concerns with them, if any, what the gaps are, and if anything indeed has become obsolete. I know that a few people have ideas about what the gaps are, and those have been referred to me. So we have a lot of work to do in the next year, and I can absolutely assure members that that work is taking place and will take place as a priority over the next year. Before we take any more money from the HIF, I would just remind members that the review of the HIF is about to start. The actuarial review has been instructed. I will see the results of the outcome of that report in Q1 of next year. I'll be able to share it with scrutiny and to publish it more widely in Q2 of next year. It's absolutely essential, as we've talked about again today this morning, that we need to think about sustainability of all our sources of funding for healthcare, including the HIF in particular. Deputy Andrews told us this morning, and I'm not entirely sure I agree with him, that the HIF would be exhausted by 2026. I don't think that's actually true, but this is not the time to take... sorry? Oh, never mind, sir. This isn't the time to take £6 to £7 million a year out of the HIF without knowing about what the impact will be on the HIF and its actuarial valuation. It's a discussion we could have next year, perhaps, once we've seen the review. I would also say that while extra GP visits for people with multimorbidities, and I accept there may be those people who do need to see the GP more often, we need to discuss that with the healthcare profession. We need to discuss it with the GPs. Any increase to anything that increases access to GPs needs to have them on board, and they need to be in agreement with how that process works, who has access to it and on what basis. It may be that people with multimorbidities have well-controlled conditions who don't need to see the GP regularly. It may be they are already being served by staff at the hospital. It may be that their conditions can be monitored routinely by visits to nurses and pharmacists. And as I've said this morning, we have put further investment into primary care to allow funding for nurses and charging by nurses. We're also working with pharmacists to make sure their services are wider. Any increase to the health access scheme will also need to be negotiated with GPs. We can't ignore GPs in any of these amendments. It would need to be discussed with them, and the system and the scheme for increased access would have to be negotiated with them as an extension to the current health access scheme contract. The health access scheme already supports those on low incomes, allows them to go to see a GP for £12 a visit and to see a nurse for £9. This amendment would benefit those on the higher incomes, and I really believe that at this stage, this is simply not the time to be taking £6 to £7 million a year from the HIF until we are very, very sure of the sustainability and future health of that fund. We will know that in Q2 of next year, and we can then start, in conjunction with the Health Minister's review, to make more decisions about what we do with primary care over the course of next year in 2024. So I would urge members to reject this amendment. Thank you.
Deputy Ward.
Thank you, Ma'am. Perhaps it's time for a non-gender specific term. I'd suggest comrade, but probably get in trouble, Ma'am. Let's move on. Ma'am, this is a good time for this change, and it is the exact use of the HIF fund that it was intended for. And it's a good time for this change because we have a new government, we have a new term. So the earlier these changes are introduced, the longer the time of the benefit of these changes will be. The longer the time there is to impact, to monitor, to see how effective they are. And then when we come to the end of this term, legacy can be left of the quality of care people are receiving. Now, we've heard a few times, particularly from one or two members, this idea of action, not words. This is an opportunity to take action, not just simply delay again for some supposed words that will come along in a review and a report. This is a specific action. And there are some nuances to this, some really particular things that we need to think about in terms of the use of that money and what that use will mean long term. Because there are some benefits, and some of them are not easily quantifiable. The ones that aren't financially quantifiable, but must be quantifiable for us as an assembly and us as a society, is the quality of life that this could improve. People with long-term mobilities and multiple mobilities need support. And that relationship with a GP, as much as anything, simply of reassurance, is very, very important. And it may well be, the other key point there, and I put it at the end of my list of things to say, but I think it should go at the beginning, is this notion of having control over your own healthcare, control over your own processes that help you with your own health. That is so important because that control is good for your mental health and good for you as a patient. You make more intelligent decisions, you make better life choices, and you're more likely to take the action that you're advised to take. That is such an important point of having a relationship with a GP. And none of us know when we may face things that we don't really want to face. And it may be the GP who picks those up when you least expect them. It can happen. And when it does, you need to have that access. And it's that point as well, which is not quantifiable, but that spotting of other issues that may come. Diabetes, for example, is a classic example. There are other issues that come from diabetes not being treated well. And if that is spotted by a GP, it can stop those even greater morbidities and that greater need long time. And that is so important. Primary healthcare is about early intervention. It's about education and it's about taking action. And if we can take this action, we have effects. And I think that's really important. The other long-term benefit of this is the savings. If we can keep people out of hospital, not only hospital isn't, I mean, the hospitals are great. The people in them are fantastic. The job they do is fantastic. You know, it just is. When you are most vulnerable, people are there to help you out. It's remarkable. I'm biased. My wife was a nurse and a midwife, and of course I'm biased, but I also saw the commitments from her friends and families and, that are made to that job. Of course it is. However, in the nicest possible way, it's the last place you want to be. You don't want to be there. And anything that can be done to keep out of hospital is useful. And the cost is also amplified whenever we are admitted to hospital, because the care is constant, it is expensive, so it should be, because you want the best care. So by keeping people out of hospital, there is a long-term saving in other areas of the health budget. And now those aren't easily quantifiable, but they can be over time. And there we get back to that point. The earlier we take action, the longer the time we have to see the effects, and the longer we have to see what that effect is and how much we've saved. And become a much more nuanced, joined-up approach to our healthcare and the provision of healthcare, particularly for those with multiple morbidities. And there was another long-term effect of illness. And this is why this notion of, oh, well, the wealthiest, there are wealthy people with money who may benefit from this. I'm sorry, but we need to remember one thing. And that is, at any time, if you are hit by a number of morbidities, very rapidly, you can become economically in a very different position. And that has an effect on society in a number of ways. It has an effect in terms of people becoming less productive, talking clinically here, not clinically in terms of the hospital, but in terms of with a lack of emotion. They become less productive in our society. Individuals can economically become less productive. And that can happen very rapidly if you are very ill and have a number of morbidities. However, by having access to the doctor and not worrying about that, and being able to continue your work or continue your life and have a better access to the income that you have, you put less of that burden on society. And I don't like that phrase, but I'm thinking on my feet here. I'm sure if I wrote this down as a speech, I wouldn't have used that phrase. But less of an economic challenge for society, that's a better phrase, in the long term. So there are significant benefits, and I really urge members of the Assembly and Council of Ministers to really think about those nuances. Think about what we're doing there. Think about the positive effect we can have for £6.5 million. And I've got to say, I do think that Deputy Southern's massively overestimated, because what he said is 9 visits for every single person involved. And the comment made by Deputy Miller, and she's absolutely right, some people are already on systems and things that they're using, so they won't need to use that. So I actually think it will be a lot less than that. But hey, you know, if the money's there and we don't use it, that's not the end of the world. It's the same with a number of other things that we do. So just briefly, I'll finish now because I don't want to get up to the 10 minutes. I really urge members, please think about the benefits of this, what we're here for. This is not about saying to people, oh, we want you to go to the doctor. I don't want anyone to have to go to the doctor, but we need to encourage the people to go when they're ill. If you have a number of morbidities, the prices rack up very rapidly. They can be very expensive each month if you're paying £50 a time. This will have a significant impact in terms of cost of living. It will have a significant impact in terms of access to healthcare, and it will have a significant positive impact on the long-term health and well-being of members of our society. So I urge you, please think very carefully and give this genuine consideration as you vote. Thank you, Ma'am.
Does any other member wish to speak? Deputy Wilson.
Thank you, Ma'am. I'd like to welcome the proposition that is actually, or the amendment which has been submitted by Deputy Southern, particularly because the attention to multimorbidity is highlighted. we know that there are over 30,000 islanders who are living with one or more long-term conditions, and we know that our population is going to increase over time. And I think some of the estimates are that by 2035, people over the age of 65 will have increased by 40%. So it's right that more and better services will be needed, but we also need to make sure that the costs of ageing are targeted and affordable. And that is why myself and the Minister for Social Security are reviewing all the user charges as part of the work over 2023 as part of the Sustainable Health Funding, which is what she's already alluded to. But what we want to do is we want to specifically look at the populations that use the health services. And I think Deputy Ward talked about this idea of early intervention. We want to understand how can we develop those interventions that will help people to lead full and independent lives. And sometimes that does mean having access to a GP, but it's also much broader than that. There are wider determinants of health that we need to take into consideration, not just a visit to a GP. There are other groups in our population that would also have a good claim for subsidised access. And clearly we'll be talking about Deputy Alves's amendment shortly. But my guiding principle is that we are committed to reducing inequality, and we do want a system of primary care that includes general practice that people can access. But that system needs to be paid for. So any proposal to provide further subsidy must explain why it is needed to ensure that the funding and financing need to come from the HIF and not part of a sustainable health funding model overall. I'm asking Assembly colleagues to reject the amendment, but in doing so, to be assured that over 2023, these matters are going to be looked at in a lot of depth in relation to our approach to the sustainable health funding model. And it will be the basis of a consultation with islanders directly about the funding for healthcare and where those subsidies can be best targeted. And I urge the Assembly members to reject this proposition. Thank you.
Does any other member wish to speak? Conotab of St Lawrence.
Thank you, ma'am. I wasn't going to speak, but I feel again it's another Groundhog Day experience for me and maybe for others, because we heard the Social Security Minister stand up and say, she completely understands. She completely understands why Deputy Southern has brought this amendment to the government plan, but she can't support it. And I don't know how many times I've sat in this assembly and heard ministers tell us that they completely understand why propositions or amendments are being brought to improve things for the public, which is what this will be doing, albeit for a targeted group. They completely understand, but they can't support it. And I ask, why can't this be supported? She went on to say, it is simply not the time to take money from the health, forgotten the name of it now, from the HIF, Health Insurance Fund. It is simply not the time. Well, my view is that it is the time, because call it the government plan, but didn't we years ago call this the budget? Shouldn't we be looking at budgeting for essential visits to GPs? And the health minister, if I heard her correctly, she stood up and said she welcomes it. But we know that we know it is right that more and better services are needed. And she went on to refer, as did Deputy Miller, to the review that is taking place. And what they want to do is wait until the outcome of that review. my view is that we don't need to wait until the outcome of that review. We know, because the Health Minister herself has just agreed that there are, Deputy Southern isn't wrong when he tells us that there are many people who suffer from a number of these multi-morbidity illnesses. And I'd like to just touch on someone that I know. New Year's Eve last year, I know someone who suffers from heart failure, chronic obstructive pulmonary disease, and asthma. He was admitted to our hospital New Year's Eve last year. A couple of weeks ago, and what are we now? December. A couple of weeks ago, he was found a bed at Sandybrook. So from New Year's Eve of last year, I think since then, he's had 2 weeks at home when he was not he was not well enough to be home. He was discharged. He wasn't well enough to be at home, suffering from ulcers and, goodness me, so many different illnesses or ailments. But one of the reasons that, and he's had terrible leg ulcers, one of the reasons is that he could not afford to go to his GP to get sorted out, to get the treatment that he needed. He also had to pay for all his dressings and everything from family nursing, but that's another matter. He had to forego some of those dressings. He had to have fewer visits from family nursing because he couldn't afford it. Now, had this scheme been in place, he wouldn't have turned round to me and said, I'm not going to the GP because I can't afford it. And that is the reality of what we are facing over here. We have many members of the public who can't afford to go to the GP. I know we're coming on to Deputy Alves' amendment in a moment regarding children. Hands up, I'm one of 5. My parents couldn't afford to take us to the GP every time we had a cough. I always say to people, unless we had a limb that could be seen to be hanging from us, we were not taken to the GP because there were 5 kids. And my parents at that time couldn't afford to do it. I think at times it was almost a case of food on the table. That was what took priority. So, not wishing to speak for too long, I've only taken 4 minutes, so it's not too bad. What else did I write down? This is another political decision. It's quite clear. What I want to know is, and maybe the Treasury Minister can stand up and address this, is this an appropriate use of the Health Insurance Fund? We've heard Deputy Ward tell us that it is. I would imagine that it is. Is it? Deputy Gorst, I ask him please to address that question. Or is it a raid? Or are we trying to plunder the fund? Or is Deputy Southern trying to plunder the fund to allow, how many people has he quoted, with multi-morbidity to access their GP? 12,000. What was it? Was it 10% or something? Or no, less than 10% of the population. Is he trying to raid this? Is he trying to plunder it to allow those people with multi-morbidity to have access to their GP? And of course, we heard this, I think from Deputy Miller and from Deputy Wilson, the age-old story that this will not only, if approved, would not only impact on lower earners, but it would apply to everyone. So whatever anyone's financial situation, they would be entitled to this. I don't view that as a problem. You know, there's always the opportunity for us to approve this and for that to be looked at, even if it needs a proposition to be brought back to the Assembly to say we should be providing for people up to a certain income. I don't know. It's not for me to make that decision. It's for the, who's responding to this, Health or Social Security Minister, I think. So my view is that I will be supporting this because I know of at least one person who has had to spend an inordinate amount of time this year in hospital, which should not have been the case had he been able to afford to go to his GP and get treated beforehand so that his medical conditions did not deteriorate to the point where he needed to be hospitalised for just about 9 months of this year. So I will be supporting Deputy Southern because I believe it is an appropriate use of the Health Insurance Fund, and I would urge others with a social conscience to support him as well. Thank you, Mark.
Deputy Bezic.
Thank you, ma'am. And I'm really pleased to follow the Constable of St Lawrence because I think that the central point she made in her speech, surely nobody can put up any contention against, which is that the effect of making access to GPs more affordable for people with multi-morbidity will be a positive benefit. Surely nobody can disagree with that and think that by doing that there will somehow be negative consequences for those people and for those who care for them. Of course, it's the case that a GP appointment isn't the only way that people may need to seek medical attention. There'll be other ways as well. And where those are more appropriate, I'm sure those people will seek them, and perhaps more thinking needs to be done in the wider context of the health service to make other forms of medical attention more accessible as well. But for those for whom accessing their GP for an appointment when something comes up, but who have to think very carefully about whether or not they can afford it, and that may be a frequent occurrence for them if they have multi-morbidities, to make it cheaper for them will have a beneficial impact. That must surely be the direction of travel, irrespective of what a review says. But in hearing that argument that we can't possibly do this now because there are wider reviews going on into this, I think that that argument could and in fact was used every step of the way when Deputy Southern fought tooth and nail for the establishment of the health access scheme in the first place. And I dare anyone to say that the health access scheme has been a bad thing. It quite clearly hasn't. To have been able to provide easier access to GPs for those who are currently covered by that scheme, children under a certain age, people in households on income support and pensioner plus, has been a brilliant thing for those people. I regularly encounter constituents who are not faced with as many tough choices when it comes to their health because of the existence of that scheme, and that so clearly will be the case for the people that Deputy Southern is seeking to have that extended to. I also have not come across any GP who I've spoken to, and you know, we're not a body as a party that holds official consultations, but we regularly do go out of our way to meet with people on the front lines of these services to understand what they think. And I simply haven't met any GP that will say the introduction of the health access scheme was a bad thing or that they would oppose it being extended. What we can do now by accepting this amendment is to give the government a mandate to go ahead and approach the representative bodies of the GPs and say, this is what we're seeking to achieve, so let's have that negotiation and go ahead and deliver it, and we have a pot of funding to enable us to do that. Deputy Ward, I think, so clearly spoke about the wider positive benefits that there are, not just the direct financial benefit to those who won't have to spend as much to see their GP as they otherwise would, but the impacts you have on encountering health problems earlier, where they're easier to treat and easier to identify what other health attention you may need, to avoid spending long times in hospital, as the Constable of St Lawrence pointed out, one example she's aware of. Just imagine how much that would have cost taxpayers and how much it could have cost if something could have been done earlier if they hadn't been put off that way. That there are savings to be made in our health service as a result of this. But the central reason why I'll vote for this amendment is that I simply believe in what was said by the founder of the UK NHS in 1945, when he said that illness is neither an indulgence for which people have to pay, nor an offence for which they should be penalised, but a misfortune, the cost of which should be shared by the community. That's the direction of travel that I'd like to see our health service go. One, in a wealthy society like ours, where we are able to help those most vulnerable, not just those who are financially vulnerable, but vulnerable because of their health conditions over which they have no control and which may simply be a misfortune for them. This quite clearly is an appropriate use of the Health Insurance Fund. It is, I hope, the inevitable direction of travel, irrespective of what a review may or may not say on it. And if you think that it's inevitable, or that this is part of the bigger picture that we haven't quite uncovered yet for what will happen for delivering primary care, then what harm does it do to take that step now? It didn't cause any harm by taking that step for Pensioner Plus, for households on income support, and for some children through the establishment of the Health Access Scheme, and it won't cause any harm to do that now by extending it to those with multi-morbidity. What it will do is it will help provide peace of mind, for one thing, for those who struggle to make those budgeting decisions in their own best interests for their health. It will lead to people seeking health attention that they otherwise might have been put off from seeking for a bit longer, and we will get positive health outcomes for those people because of the things that may be discovered, the advice that might be given, or the referrals that may be made at an earlier stage, and that will ultimately save us money in the long run as well. So I hope members who agree with the principle of what Deputy Southern is proposing will be prepared to vote for it now, because that is what we're entitled to do. We are entitled to take decisions like this, and if we have a process underway involving a review or whatever, that's fine to continue concurrently to this. We can decide, though, as a point of principle, we wish to see this enacted sooner rather than later, and whatever that review goes on to say, fine, we'll come to that when it is published. But in the meantime, let's take at least one small step, following on from the other steps that have been taken in establishing the Health Access Scheme in the first place. So I hope members will support this amendment.
Deputy Balash.
Thank you, sir. I think the debate this morning was a good one and raised a number of important issues, one of which was how the health insurance law should operate, what should come out of the health insurance fund, and to what extent non-targeted benefits should be included. It's true that the law was passed more than 50 years ago, but the broad purpose seems to me to be unchanged. It sets up an insurance scheme for contributors, and it's the duty of the Minister of Social Security to operate the scheme and to protect the interests of contributors. Benefits under the scheme can change, and indeed have changed over the years, and maybe some specific benefit for islanders with multi-morbidity should be included. But it doesn't seem to me, sir, that justifies the transfer of a large chunk of capital from the Health Insurance Fund to the Health Department, so that some other scheme can be administered, whether in relation to primary care or not, outside the health insurance scheme. It may be a good idea to allow islanders with multi-morbidity to receive GP consultations at a reduced rate. I don't know, but I do know that if it is, it should be properly costed and be seen to be affordable. Can the Health Insurance Fund bear the cost of this additional benefit into the future? We just don't know. And in response to the Connétable of St. Lawrence, that's why this amendment should be rejected. It would, in my view, be irresponsible and inappropriate to adopt this amendment in the absence of that knowledge. It would be irresponsible because we should not deplete the health insurance fund when we don't know whether it can be afforded. Otherwise, we risk damaging the primary purpose of the law, which is to enable all islanders to have access to a general practitioner and pharmaceutical support at a reasonable cost. It would be inappropriate because it would, I believe, deprive the Minister of Social Security of the ability to monitor the way in which the health insurance fund monies are being spent. If money is simply paid over to the health department, it seems to me she loses control and cannot perform the duty laid upon her by the law. And that seems to me to be wrong. In short, there is a right way and a wrong way to achieve Deputy Southern's purpose. The right way is to seek an amendment to the way in which medical benefit is dispensed so that through the health insurance fund, benefit is extended in an appropriate way to those suffering from multimorbidity. That would enable the Minister of Social Security to remain in control, which is her statutory duty. The wrong way, I'm afraid, is the one chosen by Deputy Southern and indeed by Deputy Alves in the next amendment. That way, the Minister of Social Security loses control and the Health Department can construct its own scheme, which may cost £6.5 million a year, or maybe later £10 million or £12 million, quite outside the control of the Minister of Social Security. So I would ask members to vote against this amendment.
Thank you, Deputy. Deputy Tom Binet.
Sir, I hadn't intended to speak on this at all, but not for the first time I find myself agreeing wholeheartedly with Deputy Balash. We had a result this morning that means that the Council of Ministers has got to go away and find an awful lot of money unexpectedly, and I don't think we need to add to that. This also isn't targeted, in my view, at people that need it most, and on that basis, I'm afraid it's not something that I would support, and I urge the Assembly to think very carefully and heed the words of Deputy Balash. Thank you.
Does any other member wish to speak on the 16th Amendment? Deputy Alves.
Thank you, sir. I'm glad that my colleague, Deputy Southern, has brought this forward, because actually I think it's a lot more measured than I would have if I had brought this forward. Purely because he's actually been very specific in what he's named here. He's named 12 mobilities. I actually want to talk about the other types of long-term illnesses that if I had brought this forward, I would have included it. Because actually there are a lot of the people in this assembly know that I suffer from an autoimmune disorder. This autoimmune disorder presented when I was in my early 20s. Now, fortunately, I have a very sympathetic GP, and it helped that I also worked for them. So I didn't have to worry about consultation fees. However, I won't name them because I might bankrupt them. If I had ended up having to pay for all my consultation fees, it was almost every month that I was having to go in to have blood tests. Now, in my mid-20s, if I had to do that, I can guarantee you now, sir, that I probably would not have been able to afford to buy the home that I've got now because of something that is completely out of my power. It's not something I chose, it's not something I had any choice in, and it's something that I'm going to live with for the rest of my life. It's also something that I don't have a choice, that it has to be monitored. So every 6 months, I mean, fortunately, I'm controlled now, but in those first couple of years, I wasn't. So I was in and out with the GP very frequently. I now have to go every 6 months minimum to have a consultation done, to have my blood tests monitored, and to get a prescription. In fact, I often have to go every 3 months to get my prescription because I can't get my medication for longer than that without being seen by a GP. And again, I'm very fortunate that my GP is very sympathetic and has made that affordable for me. But that's not the case for everybody. And I can't imagine how much that would have cost in the long run. There was a point where I was referred to the specialist at the hospital, which is great. And obviously there was no direct cost associated to me. However, I was going to that consultant who is, obviously we know that consultants aren't cheap. I was going to that consultant literally to get a blood test and to get a prescription. Now, I could have carried on. If I wasn't in the fortunate position that I am in with my GP, I could have quite easily have carried on because that wouldn't have been a direct cost to me. But actually, how much more would that have cost the government? So I've heard today and yesterday, and I think in all other sittings, the words review, review, review. I'm going along the same lines as my colleague when he says promises, promises, promises. And what I find, sir, and what is really frustrating is that I'm all for having reviews as long as it's about gathering data that isn't already out there. Now, Deputy Southern has been very precise in his report. The facts and the data are already out there. Why are we wasting money on a review that's then going to come to the same conclusion? The data is out there. Do we not have people who are able to pick up on this data and analyse it instead of doing another review? It just doesn't make sense to me, sir. I think, sir, ultimately, Deputy Balash made a couple of comments about the lack of detail around the spending and things like that. Well, sir, I think I'd like to remind members in this assembly that we've adopted amendments this week with less detail on spending that were put forward by the very government, not backbenchers. But yet when it's not convenient to us, we want more detail. So I think, like I said in the beginning, this is actually a very measured proposition. And if it was me, I would have extended it a lot more, because I obviously from personal experience, I'm a bit biased, but I know that there are also many other people in our community who are seeing the GP more than they should be, and it is making them question where to spend their money, and sometimes they are choosing whether that's food or to go to the GP. So, sir, I would urge members to please support this amendment. It is targeted, it is measured, and it is costed. Thank you, sir.
Very much indeed, Deputy. Deputy Renouf.
Thank you, sir. So I am perhaps just getting a little bit annoyed by the implication presented by many speakers that if you oppose this amendment, somehow you don't care about people with multiple morbidities and you don't want to help them. The issue here is not about action, not words. It's not about whether this kind of funding is a good idea. It's about whether it should be done on its own, as a one-off, without regard to the bigger picture and understanding the full implications. Deputy Mesic asks, what is the harm? The harm would be to reserve a sum of money from a finite pot without understanding the full implications and the costs elsewhere. This amendment is about multimorbidities, and they are a significant and a very significant issue, and as the Health Minister says, it is good that they are being raised. But there are many other potential calls on this funding, and in this debate we are not comparing all the different priorities. It's easy to make the case for this amendment because, of course, there could be positive outcomes. There would be positive outcomes. But what about all the other equally or perhaps even more worthy causes? What about children's healthcare? What about people with disabilities? What about people with drug and alcohol problems? What about all the other very worthy calls on health funding? So, in a way, who could not be in favour of supporting extra money for multimorbidities? Of course we want to do that. But who should benefit? How much benefit should they receive? And crucially, how should those needs be judged against other equally important calls on health funding? It's a bit like, I think for me, it's a bit like when you go into the toy shop with your kid and you buy the first thing that you see before you've seen everything else that's on offer. There are other potential health issues that need to be considered. If you vote against this amendment, you're not voting against funding for multimorbidities. You're not voting against funding for GP access. You're voting against singling out one particular demand on our healthcare system and prioritising it above all others. I know it sounds boring and it sounds frustrating, but we all know in our hearts that there is a bigger picture. That is why we need a proper, thoroughgoing review. A thorough review that looks at all the competing claims on HIF and health funding more generally. We do need the bigger picture. We need to see these needs and have them all compared. That is why we should reject this amendment and trust our Health Minister to bring forward a comprehensive set of proposals when that review is complete. Thank you.
Very much. Deputy Ferry.
Thank you, sir. This amendment requires a permanent commitment to extra government spending, for which the full costs are unknown, at a time when we have not yet agreed a sustainable funding mechanism for healthcare. The existing health access scheme already supports low-income patients with subsidised general practice services. This includes low-income individuals who are suffering from 2 or more long-term conditions. So these low-income groups will not see an additional benefit from this government spending. It would be premature to commit this significant and ongoing additional expenditure in advance of the outcome of the Sustainable Healthcare Funding Review and the HIF Actuarial Review. Other groups in our population also have good claim to access for subsidised services. For example, Amendment 18 of the government plan refers to children. Reducing inequality is key. The island requires a sustainable healthcare system, including general practice, that people can access, but that system also needs to be paid for. Any proposal to provide further subsidy must explain where the money is coming from, which is why we need to ensure that funding and financing are part of the major debate that will run through 2023. Over 2023, these matters will be looked at strategically. This will include consultations with islanders about funding and healthcare and where subsidies can be best targeted. I urge members to reject this amendment, sir.
Deputy Tadier.
Thank you, sir. It's interesting how the arguments change depending whether government decides to support or reject. So when they bring something, it's called targeted. But when someone, a backbencher or an opposition party bring a proposal forward, which is to help a specific group of people, we get accused of singling out certain people, playing off parts of our community against the other. We get questions about what other worthy causes could this money be used to pay for. And the Council of Ministers have not told us that they've earmarked this 6.5 million. Remember, this is 6.5 million pounds from a specific fund, the Health Insurance Fund. The clue is on the name, isn't it? Health Insurance Fund. What's it to be used for? For health insurance for people who need it. And these are people who have paid in one way or the other, and these are people who need it because they've got multiple morbidity. And surely the lowest common denominator in any society, irrespective of what your policies are from right to left, is that if we're going to pay tax, and if we presume that we believe in some form of government, and I have no doubt that there are people, certainly in the wider community, sir, but possibly even in this assembly, who don't really believe that the state has any role, which would be ironic given that we're all states members. I hope that's not the case, is that the lowest common denominator should be that we look after the very most in need in our community. And I didn't necessarily want to get overly philosophical today, sir, but I always come back to the philosophy of the moral philosopher in the political sphere of John Rawls, who talked about the justice principle. And if you didn't know what role you were going to end up with in society, in constructing your idea of a just society, what would that look like? And he talked about putting on the veil of ignorance, sir, so that when you make the rules of a game, it's better if you don't know what role you're going to have in that game. You don't know if you're going to be super wealthy, super fit, super intelligent, or if you're actually going to be somebody who at some point is going to be struck down with multiple morbidity or various health afflictions, sir. What I've realised by talking to people over the years is that whatever our differences is that health is the great leveller. And those aren't my words, those are wise words that I've heard on the doorstep over the years, because I've been back to see the same people, and some people you realise are no longer there. They've ended up in care homes, they've ended up passing on, and that health affects everybody. There's nobody who's too rich, too high or too mighty to be struck down by a particular illness or by multiple conditions. And let's get back to the reality of what we're debating here. We heard about pragmatism earlier. We heard about targeting benefits. So yesterday, when we were discussing a £330,000 giveaway to people who might not need it, the question from government wasn't what could that money be used for. The point is we know exactly what this £6.5 million is going to be used for, because Deputy Southern's told us. It's to treat those who have got multiple morbidity, multiple conditions, those who do need to go and see the GP, those who are unlikely, therefore, to be able to afford it. And, you know, I've been reading through other manifestos. I've been reading through the manifesto of the Jersey Liberal Conservative Party, which partnered with the Progress, and there were 3 of their members in the Assembly. And they've talked about the need, I won't quote it verbatim, but they've talked about the fact that we have a health insurance fund which is set up for this purpose, which hasn't been altered since 2012, and that they want everybody in society to be able to access a GP when they need it, and they want it to be affordable, sir. Yet we have a group here who we've identified struggle the most. And of course, the argument then comes back, well, we should be looking after everybody. And we know full well that if any member in the Assembly came forward with a comprehensive system saying that we want to actually have free GP visits for everybody, that would be ruled out of order politically for different reasons. So it's like you can't win for trying to do the right thing here. What is the state of the HIF at the moment? We're told that the projected estimates for the starting balance of the HIF in January next year is £86.1 million. Deputy Southern's asking that only 6.5 million. Sounds like big figures when you just take it 6.5 million, that's a lot of money. But the reality is that 7.5% of the overall fund being spent for a purpose which the fund is there for anyway. That fund is easily going to be sustained. I suspect the interest alone on that fund would pay for that withdrawal. But let's not get down into the minutiae of those figures, sir. But the reality is that would be money well spent for people, well targeted, like the government has sought to bring in other targeted measures to relieve people during an emergency period in the economy. But we also have another emergency in our community, which is a health emergency. And this money, quite correctly, will deliver tangible outcomes for all of our constituents, sir. And I do ask for members to put aside their perhaps ideological differences and to support, sir, what is a good plan, even if they might not think it's a perfect plan.
Thank you, Deputy. Does any other member wish to speak on the amendment? Deputy Gorst.
Thank you, sir. This morning, sir, when the greffier was sitting in the where you're sitting now, the Assembly very, very clearly said to ministers, enough is enough. We only want you to transfer money out of HIF in the purposes that were determined in the health insurance law, and even that we think has gone too far with its most recent amendment. We certainly do not sir, want ministers to transfer money from the HIF to the Health Department for them to decide how they're going to spend it on primary care. Ministers heard that message. We were slightly criticised for being a little bit down in the bit grumpy in light of that very clear message from members, but we understood entirely why members were telling us that. They want primary care to be properly thought through, for ministers to make sure, and as we said then, the Social Security Minister, to make sure that the health insurance fund is used appropriately and has got a sustainable level of funding in it. Not to come along and no matter how good the proposal is, no matter how in this instance it might be directed to the purposes of primary care, as the Health Minister indicated her £4 million was this morning, but not to do it without a proper sustainable funding methodology, without thinking about the difficulties that GPs are currently facing about recruitment and appointments, without thinking, and maybe this is me reading between the lines, without thinking about appropriate co-payments for GPs, and without thinking that that's those, as we've just been hearing about, who can't afford to access primary healthcare. And having listened to that message this morning, in the words of Deputy Ballas, we have listened. We are returning to Broad Street with our instructions clearly from this Assembly. For my part, sir, that is a message ministers have received. I've received it. It will have implications for how we think about health budget going forward. But I would be very surprised if this afternoon members then decided that weren't quite sure about that anymore. They do actually want to give the Health Minister a chunk of £6.5 million, which may or may not impact the sustainability of the Health Insurance Fund, particularly when there is ongoing work. So I make no comment about what the Deputy is proposing this money to go to, or the next amendment that we've got. I'll leave it to others to do that. But it would be run completely counter to the message that members sent to ministers this morning, which I think was a very clear message, which I understood the reasons why. It's got some difficult implications for us. We've got to regain the trust of the Assembly and the public about all of the money that we're spending in the health service, and the way that we're structuring our health service, and the way that we're administering health to islanders, because this Assembly indicated it wasn't satisfied with that. And we take that away and we will act upon it. So I do ask members to think very carefully before they make a decision in what would, to me, appear to be completely the opposite direction. Thank you.
Thank you very much, Deputy. Does there any other member wish to speak on this amendment? Deputy Cates.
Thank you, sir. This amendment by Deputy Southern makes serious economic sense. People with multi-morbidities are vulnerable to developing many more health conditions. By seeing the doctor at the right time, serious complications can be nipped in the bud. Such complications, untreated, are likely to end up costing society a lot more than the cost of reduced GP visits. And that's not even taking account of the personal and social implications. And of course, any new scheme needs to be discussed with GPs, but the decisions must be made by this Assembly. Does this Assembly seriously want to make it hard for people with chronic sickness to get the treatment they need?
Deputy Scott.
Thank you, sir. What makes economic sense is proper planning, sir.
Does any other member wish to speak on this amendment? No other member wishes to speak? Then I close the debate. Call upon Deputy Southern to respond.
Thank you, sir. And I should attempt to be brief, as all of us have been doing today. An early contributor said, why aren't we talking to the GPs at the moment? The answer is we're not. We've stopped consulting on primary care. We certainly don't talk to the primary board. And we should be doing. Because what we should be doing as members of this assembly is putting pressure on our ministers to actually act. It's that, back to that phrase, act, not think. Also, somebody early on said, and what about those on higher incomes? And to which I would respond, and what about those who are just managing? Not on income support, but a £50 bill coming from a GP, something that they find difficult to cope with, two on a row, two in a week, and they're struggling altogether. So it's not an absolute measure, but certainly the people I'm talking about, those with multiple morbidities, have to have more visits than normal, than average, and therefore have higher bills than average. And in order to cope with that demand, I think we should be pressing our ministers to actually get talking to the GPs, the primary carers, and seeing if we can't work together to cater to keep this group of people out of hospital. Because as many people contributing today have put it, then we want to reduce inequality and we want to keep people out of hospital. There's a long-term saving in doing so. I was asked by the Constable of St Lawrence, is this a political decision? To which I would respond, absolutely. Every decision we make in this chamber is political. The political aim that should be happening now around this proposition is that we should be putting political pressure on our ministers to actually come up with a scheme that starts to look like it can work. Because we've abandoned primary care for some time now. It's nice to notice that we're back to normal with Deputy Balash. I had a rush of blood to the head when I heard his contribution earlier, but it's back to normal now. And yes, what we need is access to GPs at a reasonable rate. That's what Deputy Balash was saying. I was taken aback by Deputy Owl's contribution with her autoimmune condition. I never thought about this group of people. I should have done, I think, and included them. And then she went on to suggest that what we've got here is review, 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 and do nothing. If we're going to make this work, then what we need to do at this stage is to put pressure on our ministers to get around the table with GPs and other primary care deliverers and sort out a system as soon as possible. Not 6 months down the road when we've done all the fact finding, but start with a process that enables us to actually get some assistance to this particular group of people. Thank you, sir.
Very much. The appell is called for. I invite members to return to their seats. And I ask the greffier to open the voting and members to vote. Vote is on the 16th Amendment. If members have had the opportunity of casting their votes, then I ask the greffier to close the voting. The amendment has been defeated. 14 votes pour, 32 votes contre, no abstentions. 14, yes.
Those voting for the Connotabs of St Brelard, Trinity, St Peter, St John, Grouville. Oh, sorry, I was looking at the wrong one, sorry. Those voting for the Connotabs of St Lawrence and St Martin, Deputies Southern, Tadier, Rob Ward, Alves, Farnham, Mesick, Coles, Porray, Catherine Curtis, Feltham, Jearn and Kovac.
Very well. The next amendment in the running order is the 18th Amendment, free GP visits for children and young people, lodged by Deputy Alves. The main responder will be, of course, the Minister for Health and Social Services and for Social Security. And I ask the greffier to read the amendment.
Paragraph C. After the words Appendix 2, Summary Table 3 to the report, insert the words, except that a new line should be inserted in Summary Table 3 to include a transfer of 800,000 from the Health Insurance Fund to the Consolidated Fund to allocate funds for the provision of a scheme to allow children and young people from 0 to 17 years of age to receive free GP consultations. Paragraph E. After the words Appendix 2, Summary Tables 5, 1 and 2 of the report, insert the words, except that, in Summary Table 5.1, the head of expenditure for health and community services should be increased by 800,000 to allocate funds for the provision of a scheme to allow children and young people from 0 years to 17 years of age to receive free GP consultations.
Deputy Alves.
Thank you, sir. Childhood is arguably the most vulnerable period of human life. Children are highly dependent on others to have their basic needs met, and this makes them particularly vulnerable, especially when there is a cost to filling those needs. Although I commend the government in establishing and maintaining the Health Access Scheme, which supports children in low-income households with free surgery consultations, this scheme is not foolproof. What about those who are low-income households but do not qualify due to residency restrictions? Or those who do qualify but do not know that they are eligible for this support? We heard just 3 months ago from the Social Security Minister in her answer to an oral question about eligibility for the community cost bonus that government do not target communication directly to those who would be eligible for benefits. So how many children from low-income households are potentially missing out? The fact of the matter is, sir, whether you are born into a financially comfortable family or not, if you are a child, you are vulnerable. So when I read the government comments where they have said, and I quote, the creation of an additional scheme, as the amendment suggests, will not benefit low-income children who qualify for the Health Access Scheme. Although the Council of Ministers recognises the impact of the cost of living is having on a high number of households, the benefits of the amendment would be felt by children in higher income groups. Does this mean that the government thinks that those children in higher income groups do not deserve or need to feel the benefit of this amendment? That these children are no longer vulnerable? I think this shows that the government have a real lack of understanding of what it means to be a child and the vulnerabilities that that brings. Children do not have their own autonomous access to income, regardless of their family's economic background. All children deserve this, and all children are vulnerable. 2 years ago, sir, I brought forward a very similar amendment to the government plan. And in that speech, I quoted the then Children's Commissioner, who said, I have witnessed firsthand the struggles many guardians have when deciding whether they can afford to take their child to the GP when they are unwell. Many will often wait it out, hoping that their child will get better. Some will go to the doctor straight away, but have borrowed money or had to budget and ration carefully. I have seen children end up with longer-term health problems and visits to specialists which could have been completely avoided. I have seen teenagers being reluctant to visit their GP with their parents or feel they cannot speak openly to the doctor because the parents are present and because they have to be in order to pay the bill. These barriers should not be in place for young people. A child should be able to see their GP when they need to without any financial concern. Prior to being elected, I worked as a part-time translator for medical surgeries as well as a secondary school teacher. I too experienced firsthand numerous children and young people that needed to go to GP but wouldn't or were reluctant to, not because their families couldn't afford it, but because they didn't want their families to find out, either through embarrassment or worry or shame, especially if they were suffering with mental health or sexual health issues. Now, I know, sir, there are free sexual and mental health services, but these services are often public places, and so sometimes young people do not like going due to a lack of privacy and the risk of seeing fellow acquaintances there. When left with no other choice, they would rather go without. The findings of the recent Jersey Opinions and Lifestyle Survey report found that 41% of adults said that the cost of an adult GP appointment stopped them from attending. These adults are not just from low-income families. These adults will include Middle Jersey, who are already having to make tough decisions about where and what to spend their money on. The government costs are a huge barrier to accessing healthcare. When people must choose between paying for food and rent or paying for healthcare, many forego healthcare. It is an unacceptable choice. The government has in the past negotiated for some services provided by GPs to be free, such as cervical cancer tests. Does this not prove that prevention is better than cure? And why does this not apply to children? Finally, sir, I wanted to keep my speech short, so I'm going to finish with a direct quote from a letter that was sent to the government from the Children's Commissioner, a couple of years ago. The UNCRC is clear that all children and young people up to the age of 18 are entitled to special measures of care and protection, including their right to health. This right applies to every child, as does their right to be free from discrimination under Article 2 of the UNCRC. Any fees to access healthcare services prevents barriers to children and young people from accessing their right. The Committee on the Rights of the Child has been clear on this, stating that barriers to children's access to health services, including financial, institutional and cultural barriers, should be identified and eliminated. Every child and young person in Jersey should therefore be able to access healthcare for free, regardless of the child or their family's economic situation, or any other factor, as children are the right holders and the state is the duty bearer. So I ask members, do we really need another review to tell us what we already know? Do we really want to add further delay to something that could potentially save a young person's life now? So, sir, I urge members to support this amendment, and I move the amendment.
Thank you very much, Deputy. Is the amendment seconded? Yes, sir. Does any member wish to speak on the amendment? Deputy Miller.
Thank you, sir. The Constable St Lawrence. Constable St Lawrence, I think, has twice today used the words Groundhog Day. And I'm also beginning to feel like that over the course of this current debate, but now also our last sitting where we talked about the common strategic priorities. I will come on to that. I'm not going to insult members by saying all the things I said before about the Health Insurance Fund. I'm sure you can all remember them, because much of them also apply in the context of this proposition. I would like to take the opportunity just to make a few further comments arising from some of the observations that have been made after I spoke in the last, regarding the last amendment. I'm not quite sure where Deputy Southern is obtaining his information, but the Minister for Health, the Assistant Minister for Health and the Assistant Minister for Social Security, Deputy Ferry, and myself met the Primary Care Board last week. The Minister for Health has met them more than once. I've met them again with my officers that previously. We are talking to the Primary Care Board. We have committed to working with them in an open and collaborative partnership to make the amendments and the changes that we need to ensure good primary care. We are talking to them and we will continue to do so, and it is simply incorrect to say that that's not happening. I feel deeply for Deputy Alva's own situation, and I'm sorry that she had the difficulty she had as a younger when she was in her 20s and she was first diagnosed. But some of her comments absolutely demonstrate the issues that we've been talking about. When I last saw a doctor to have bloods, I saw the doctor and then I was sent back the following day to see a nurse to take my bloods. Deputy Ward would tell you that a nurse is more than capable of taking bloods and that you don't necessarily have to see a GP. And as for the prospect of going to see a consultant to have bloods taken, then that is frankly absurd. And that is why we need to look at how our primary and healthcare system works to make sure that we're using the best use of our healthcare professionals and we're getting the best use of their time. Because as we've already said this morning, doctors are under a huge amount of pressure. Deputy Scott mentioned that when she talked about GP stress. I'd also just make one last comment about the HIF itself. The HIF is not actually an insurance fund. Yes, people live here and contribute to it, but the HIF will pay for medical care for anybody who has lived here for 6 months, whether or not they've contributed. So if you move here as a pensioner, you will get healthcare whether or not you've made contributions. So somebody who could leave Jersey as a young person, go away, make their millions in the UK or abroad, and come back to Jersey to retire, and they will be supported by the HIF, because that's the way it works. It supports everybody regardless of contribution. So by some of these schemes would actually be helping people who haven't contributed to the island. That's not to say we don't want to expand and make sure we have the best healthcare system that we can and we can afford. Just turning particularly to Deputy Alva's amendment, I just, and the Council of Ministers, found it quite surprising because this Assembly very recently endorsed our Common Strategic Policy, which included a commitment, and I quote, to work towards providing free or lower cost primary healthcare for all Jersey's children and to reducing other barriers to children accessing primary healthcare as part of the ongoing review of the island's overall health and care system and its sustainable funding. That was following an amendment by the Children, Education and Home Affairs Scrutiny Panel. And it was approved by them. In fact, the panel itself agreed that charging was not necessarily an issue. This commitment was made only a few short weeks ago, and it's disappointing that this amendment chooses to ignore that commitment and that proposition and bring forward and refer to reports made in 2019 and 2020. It doesn't take account of the CSP commitment, which we debated, I recall, at some length. This amendment is premature. It is also unfunded for the same reasons we've gone through, and the cost quote in the amendment is likely to be a significant underestimate of the actual cost of free GP visits. It will support those on higher incomes. Yes, there are people who are struggling, but there are many people in this island for whom a free GP visit, who can afford to pay, but free GP visits, we will find ourselves with taxpayers and contributors paying for very wealthy people to take their children to the GP whenever they want. And the notion that rich families are not taking vulnerable children to the doctor, I think is just it just doesn't hold any water. Any parent will take their child to the doctor. If they can afford it, they will take them. The Health Access Scheme, and nobody, to respond to Deputy Mezek, nobody is criticising the Health Access Scheme. The Health Access Scheme provides free GP visits for children in income support households. We did communicate that. We have communicated that to all income support households at the time the Health Access Scheme was introduced. And I asked my officers to remind people of that in our most recent communications, to remind them that that Health Access Scheme exists and that people on low incomes can take their children to GP free of charge. So it's wrong to say it hasn't been communicated. Many GP practices themselves offer free medical visits for children under 5. So to say that there is a dearth of care and provision for young children is not true. We do need to look at the whole picture. We are trying to do that, and it will take some time to understand how we do a sustainable funding for our healthcare system to make sure that we have the best system we possibly can for our children and for everybody on the island. I urge members to reject this amendment. Thank you.
Very much. Deputy Mezek.
Thank you, sir. The one advantage of Groundhog Day is that as time goes on, you get to predict what's about to happen. And so it's surprising that the Minister is surprised at where we are. And what I would have hoped she would have done is listened to what Deputy Alves said in her opening speech and amended her comments accordingly. So I have absolutely no problem whatsoever with paying tax into public spending funds that will go towards paying for services for which people who are substantially wealthier than me will benefit from. That's what we pay tax for, so that we can provide universal services for everyone. We pay progressive rates of income tax based on what people are capable of paying. That's how you make it equitable. And providing that at the point of use on services and introducing bureaucracies to determine who gets a greater subsidy and who doesn't is often not an efficient way of doing things. The principle of universalism in public services is a good one. And I would point out to the Minister, we're already paying to subsidise the fees, the GP fees of wealthy people, because they get the subsidy too that exists. So that's not a new concept. But what provoked me to put my light on, because I was actually angry about this, is when she said that those children from wealthier families, well, their families will still be able to afford to see the GP. She wasn't listening to Deputy Alves. It is important that children have the right to access healthcare in their own right, not because of what family they are from. And the reason for that, sir, and I'm sure there are members in here who remember what it was like to be a teenager, but when you're going through particular issues in some of those years, the last people you want to talk to about it are your parents. And so if you have to go begging to your parents for money so you can go to see a GP, some young people will find that embarrassing and off-putting, and so they won't do it. The point of this is to make it independent for them. And not only is that, in my view, morally the right thing to do, but it's actually, indirectly, something we've already committed to. And we've done that not just from the amendment from the Children, Education and Home Affairs Scrutiny Panel, but we've done that before by agreeing to sign up to the United Nations Convention on the Rights of the Child. It is black and white in that document that children have the right to healthcare. It's their right, and as the elected representatives of the people of Jersey, we are the duty bearers here, and it is our duty to ensure that those children have that right realised. And right now, by their access to healthcare being determined by what family they're from, we are in breach of that part of the UNCRC. That doesn't mean that we have a big red mark on our name according to the UN, because it doesn't quite work like that. What the UN expects of us and what they will judge us on when it comes to their regular updates on where Jersey is with its fulfilment towards the UNCRC is what progress we're making, if that's the direction of travel that we're going in. And so whilst in the CSP we agreed to this principle, rightly so, and I'm glad that that was accepted by the government, yes, it's right that there's a funding source for that, and Deputy Alves has found one. And she's found one from the pot of money where, at this point, it ought to come from, because that is currently how we fund these things. That can change in the future if you want it to. If you want to reform how we fund primary care in the future, no problem, we'll have that debate when it comes to it. But for the moment, that's the source that we use to fund access to GPs, and so there's nothing inappropriate about doing that. What Deputy Alves is asking to allocate for this change in policy is a substantially lower amount than the amendment we've just debated from Deputy Southern. I wish that one had been accepted, but you must surely recognise that the amount that Deputy Alves has asked to making this a reality is a very small amount in comparison to that. So if you did have concerns previously about the sustainability of the health insurance fund, I'd say at this point we're looking at a much smaller amount of money, so that is not as much a concern. But if that is still a concern for you about any money being taken out of the health insurance fund to pay for an increased support at this point. I've got some good news for you, which is that later on in this debate, you will have the opportunity to vote for an amendment which will put millions of pounds extra towards those funds through scrapping the regressive caps that we have on these taxes. And if you want to make the wealthier pay for it because you think it's unequitable to provide free GP visits for children from wealthy families, that's how you make it equitable, by making them pay the same amount proportionately as the rest of us. So, sir, we have the opportunity right now to support an amendment which will realise our commitment under the UNCRC to provide healthcare, primary healthcare, free at the point of need for all children, irrespective of what families they're from. And we have a mechanism for funding it which is more than sustainable. You want to talk about how that will change in future? Great, we'll have that discussion another day, but we can do it now. This amendment does work. And don't believe anyone who tells you it doesn't, because the numbers add up here. I hope members will support this proposition and will realise that right under the UNCRC sooner rather than later.
Thank you very much, Deputy. Deputy Doublé.
Thank you, sir. I have considered this amendment really carefully and mulled over various things. And I was, actually a lot of the points that I was going to make have been made by previous speakers. I was undecided about this for some time. And initially my feelings were that I felt that perhaps a small nominal charge would be appropriate. Because I know that there are some shortages in primary healthcare, particularly GPs. But I did look back at the information that came from the Children's Commissioner and the legislative gap analysis. And healthcare is one of the most fundamental human rights, access to good quality healthcare. And as previous speakers have stated, children are amongst the most vulnerable groups in our island. And I think whilst again I did consider that there could be other options that we could provide, perhaps nurse-led clinics could be the first port of call for free primary healthcare. And I think there's nothing stopping government exploring those options. And I actually have confidence that government will also explore those options going forwards. I have decided that I will support this. And the point that swayed me, again, it has been made by previous speakers, but I want to explain the point that I have been persuaded on, and it is the ability for children to access healthcare under their own steam, regardless of their parental income. And I don't see that point can be argued with. I think it is so fundamental to the autonomy of a child as a human being in their own right, once they reach an age where they can competently make decisions about their own health, to be able to access that healthcare. So I will be supporting this, sir, and I do think it's doable. I think we may have to do some additional, implement some additional measures, perhaps like nurse-led clinics as an extra facility to accommodate some of those common childhood illnesses and to make this achievable. But I do think it's doable, and I do think it's important that we approve this today.
Thank you very much, Deputy. Deputy Taddy.
Thanks, sir. I'm glad to hear from, although we don't have actual ministers for things like culture or for the environment or for children, we have delegated responsibility, and it's really important to hear the Assistant Minister with delegated responsibility for children, who works very closely, I know, with the Minister for Children and Young People, to come out in favour of something which is designed to help children and young people. And one would hope that she's been appointed to that role because she's the right person for the job and she's trusted to make political decisions, and I would encourage her ministerial colleagues to support her and come to the same conclusions as her for that. We know that also she, of course, moved in the previous Assembly for the UNCRC to be adopted in principle by this Assembly, And there's so much good policy in that which we need to get to grips with still, which Deputy Mezek has reminded us of as well. I'm particularly concerned when I heard the politics of envy that are coming from the Minister for Social Security. She's trying to divide the island between the rich and the poor, saying that the rich who have children don't deserve to be able to go and visit a GP for free. I disassociate myself from that because I don't believe in those kind of politics of envy, sir. I believe that you pay for general taxation and that there are certain things which, under the social contract, we all agree that everybody has equal access to. And for example, I wouldn't have said when I was a primary school pupil at Lemoy, why are there some very rich people here getting free education alongside me? And when I went to Lekeneve School, I didn't even think about socio-economic distribution of our class. I've no doubt that there were some people in the class who struggled. I know we weren't necessarily in a completely dissimilar situation to the Constable of St. Lawrence. I remember growing up with 3 other brothers in my family, and you would often be fighting for the last chicken leg or that bit of crackling that you got on the pork on a Sunday once a month. And you know, things might have changed a bit as you grow up, but you realise that, and I don't know whether our family would have even met a socio-economic means test, whether we'd have been considered too poor or too rich, and where you would have set that ceiling. And I also know that you know, there's more to life than just the income you get, and that families find themselves in very difficult situations. What do you do if you're a rich child? As far as I'm concerned, there aren't any rich or wealthy children. You might have families with higher incomes, but all children are the same to me, and they deserve the same access, which is why I agree with Deputy Doublé. You have a family that is perhaps not living together anymore, or they've got one parent who's very wealthy, another parent who doesn't have much income, possibly on income support. How would they be viewed? Would they qualify for the test? Would they get lots of bureaucracy saying, well, actually, you've got to get one of your parents who's a high earner to talk to the other one, even if that's an estranged parent, where communication might be very difficult, sir. So I don't have a problem if a few children from a rich family who don't currently go to the GP, or even if they do, get access to a scheme for children, which means they don't have to pay for it. I'm quite happy and comfortable with that, because I think universal healthcare is something we should aspire to. But in the absence of that, as a general policy, I think the policy of putting children first, which I signed up to in the previous Assembly, is still something that I think I aspire to, and I would hope the rest of the Assembly also aspire to, sir.
Thank you very much, Deputies. Any other member wish to speak on the amendment? No other member wishes to speak. Deputy Catherine Curtis.
Thank you. Thank you, sir. The Children, Education and Home Affairs Scrutiny Panel recently brought an amendment to the Common Strategic Policy, which was that we will work towards providing free primary health care for all children in Jersey. Following amendments to amendments, the Council of Ministers included in the CSP the aim to work towards free primary health care or lower cost for all children, which the panel welcomed as a step in the right direction. But we must remember that any fees to access healthcare services present barriers to children from accessing their right to healthcare. The current situation is that 2,642 children get free GP visits, 14,000 do not. That's 14,000 children whose parents will have to pay for them to see a GP. Not all of these children have parents able to pay this, and many children may need to see a GP without the support of their parents. Charges for children to see a GP average around £30 for 10 minutes, with home visits at around £110 to £140. There are many families above the income support threshold who are struggling to pay their bills and hold off from seeing the doctor. Evidence supports this, including figures from the Accident and Emergency Department. The figures show that around 70% of emergency department attendances by children
were classed as non-urgent. We cannot be sure how many of these children were there due to cost alone. However, we should consider that surveys such as the Jersey Opinion and Lifestyle Survey found that 1 in 6 households delayed seeking medical treatment because they were concerned about the financial cost. When considering the cost implications of a plan for all children to have free primary care, we must consider there is a cost for not doing so. The immediate financial cost is borne out through unnecessary use of accident and emergency department. There is high cost to all that medical professional time. The longer term financial costs occur through illness treated too late, potentially leading to acute episodes and long-term conditions. The policy in the CSP to aim for free or lower cost primary care for all children is a step in the right direction, but we must aim for truly accessible health care for all children and bring that in without delay, which is why I will be supporting this amendment. Thank you.
Thank you very much. Deputy Rob Ward.
Thank you, sir. I'm genuinely very pleased to follow that really reasoned, calm and detailed explanation of why this is a very simple thing to support. And I was going to mention something that somebody talked about UNCRC, and if you go into any of our primary schools and secondary schools, you'll see a display on the wall on the way in which says that we are a rights-respecting school, and all of our young children are being taught about being a rights-respecting school and the rights they can expect because of their childhood in our modern society. And one of those is, has been pointed out so many times, access to free healthcare. Now, I don't think there's anyone in this assembly who would not want to do the best for our children, regardless of our political hues. I know that we all want to do well. But one of the things we have to do is we have to come to a consensus on our approach to our children, and whether or not what we want to do is treat every child as though it was our own. That's what corporate parenting is. Our responsibility as a corporate parent is to do exactly that. And that means giving access to every child to the best that we can. This is affordable, £800,000. I've got two figures in my head for the HIF, of either 48 or 84 million, and I don't know which it is. Let's take the lower one. That's 56 years of paying for this. It's absolutely affordable for as long as we need, as we're reviewing and come up with a better way to do it. That's absolutely fine. But this is about action, not words again. We keep hearing that. Let's take some action. Let's not just have the words. Let's not just have another review. And the notion that this is premature to take this action, let's think about that notion, shall we? It is not premature to say, in the first government plan, in the first real big decision-making process we've taken in this assembly, at the end of this, to say to parents, we are acting to say to you, you can take your children to the GP. Don't worry about the cost. And we are saying, most importantly, to young people, and I'm going to use the phrase young people, okay, that you have autonomy in your own right to be listened to be respected, and to be able to access the GP. Now, all of us as parents want to believe that our children will talk to us about everything. Of course we do, because we're all perfect parents, you know. We're all perfect in every single way. I certainly am. But sometimes, you know, our children don't want to talk to us about things, and they need to go and talk to someone else. And, you know, giving access regardless of your socio-economic background, and they are complex situations. If you've spent time with young people, particularly 15, I'm going to pick out 14 to 16 age group, okay, in particular, there's a complex time in young people's lives, and they need any support that we've got. And this is £800,000, a fraction of the HIF fund, to access primary health care for free for our children. That's the sort of legacy we should be leaving. That's the sort of message we should be giving to people. And that is a rights-respecting assembly, not just rights-respecting schools. We can go into these schools now and say, you know what, all these things that you're talking about, we are taking action on straight away. We don't believe we have to wait because you're the most important thing on our island. And that is the way in which our children become valued. And this is one simple way to do it. So I'll finish by saying this. It's not about you not caring if you don't do something. I don't know where that's coming from. It's saying that these are opportunities we mustn't miss now. So please don't reason your way out of it for whatever process that you want to go for. The UNCRC and all of those things that come with it enrich our society, enrich the experience of our children, and enrich the safety of our young people in our society. And I think we should incorporate it, embrace it, and then act upon it. So I urge members, please consider this. Please think it through, and please support this very well thought for amendment from Deputy Alves. Thank you much.
Very much, Deputy Chief Minister.
Thank you, sir. And, well, the best way to start this speech, I guess, is to say, well, of course, we do all agree, because as the Minister for Social Security identified during her speech, we did agree this in our debate during the Common Strategic Policies. But of course, Deputy Alves' well-intentioned amendment here was lodged only 2 weeks ago. This is, I think, a practical issue that we have with the government plan, that there are a considerable number of issues to consider in a very limited amount of time. We actually think that Deputy Alves' figure is not quite right. My very simplistic way of approaching the figure is that it would be almost twice the price, because if we considered that all of the 14,000 children in this age group were to visit the GP twice in a year, on average, then of course it doubles the figure. So I think that simple equation just shows, albeit that we agree, there is a need to build this element of healthcare and access to GPs for children into a proper sustainable funding mechanism, which will be delivered this year. And I do commit to doing that because, well, clearly, sorry, in 2023. I do commit to doing that because it's important. We have agreed to many elements of delivery of healthcare going forward in recent debates. And it is very clear from the speeches of many eloquent and excellent speeches that have been made in the past couple of debates that we are, as an assembly, seeing some consensus being achieved. And we want to change our systems and move forward and improve the delivery and access of healthcare for a greater number of people. Yet, we simply have to do, as Deputy Scott said in her exceedingly brief but very pertinent speech earlier on, we have to do the planning. And so I would ask members to please bear with us to see that we have the additional months that we need to properly deliver a sustainable funding mechanism during 2023, which will be properly planned for, and then we can deliver exactly what we need, and in the proper way, sir. Because Deputy Mezek may hope that he will win his amendment later in the day, but of course he doesn't yet know that.
Very much, Chief Minister. Deputy Jean.
Thank you, sir. And though I've heard the Chief Minister in her points that she has just raised, I'd like to say that I will be supporting Deputy Alves with this amendment because, like others, I think that it is the right for children to have access, and it doesn't matter where they come from. And actually, I'd like to give a quote from Mr. Bevan, who was the founder of Britain's National Health Service, that said, "The essence of a satisfactory health service is that the rich and the poor are treated alike, that poverty is not a disability and wealth is not an advantage." And therefore, I think that this is really important, but also because I remember during the elections that we had a discussion with the primary care body in Jersey, and they were very, very clear in their messages that primary health care starts from when you were born, even in fact before when you're in your when you are part of your mother and growing as you were developing. And this will play out in 40 years' time when we will have issues later in life with our acute care. And therefore, it's absolutely essential that we need to put as much resources and support for the first 100 days, and also for the first for children in their health, and supporting them to have access wherever they come from, because I think it's really important for the future, and it will actually have a big impact in 40 years' time on our healthcare if we aren't able to support them in their primary healthcare. Thank you.
Does any other member wish to speak on the amendment? Deputy Gorst.
Thank you, sir. I know that standing order says one shouldn't repeat points made by others, but we are in a different amendment now, and I just want to reiterate the point alongside the points that the Chief Minister just made, and I fully support she is committed, together with the Minister for Social Security and the Health Minister, in delivering on that strategic plan amendment. And I know she's very personally committed to that, and she would share complete alignment with the Energy Minister's point of view and commitment to the 1,001, I was going to say the first 100 days, 1,001 days agenda and all that means. And I make no comment about that because it's absolutely the right thing to do. This amendment, however, takes money. It will be an unspecified amount because one trip to the GP for every islander under 17 and under will not satisfy the need to visit a GP. So it will be considerably more than is suggested here. And it also means that it will be a scheme that's developed by the Health Minister. And I don't comment on the Health Minister personally, but it will then be her officers at Health and Social Services, which will be, if we accept this amendment, as opposed to working with the amendment to the strategic plan, I think it's called something else now, so sorry, which would allow the joint working and the oversight of the Social Security Minister, which again I think is a thing that the Assembly really wants ministers to do, with appropriate rigour, and able to provide appropriately and give effect to that amendment to the strategic plan. And it's for that reason, sir, not because of the underlying desire of the proposition, but the mechanism that it uses, which I think is inappropriate and out of kilter with what actually members want to see in government, that I can't support this, but I very much do support my colleague ministers in the work that they are doing to work towards free healthcare for children, as was accepted in the strategic plan. Thank you.
Thank you very much. Mr. Attorney, did you wish to contribute?
Sir, yes. I apologise for not being in the Assembly, but fortunately I was not feeling particularly well, so I thought it better to attend by Teams. I just had caught comments by members in relation to the UNCRC, and I just thought it would be helpful if I just set out a slightly more nuanced position as regards Article 24 of the UNCRC and what it does and doesn't require states parties to do. Essentially, the key articles are Article 24 of the UNCRC and Article 4. So Article 24 does require states parties to recognise the right of the child to the enjoyment of the highest attainable standard of health and to facilities for treatment of illness and rehabilitation. And it also requires states parties to strive to ensure that no child is deprived of his or her right of access to healthcare services. So those are all accepted. But I have to state that there's no requirement in Article 24 on states parties that healthcare is to be provided for free. nor is there any such requirement in the general comment, which is the authoritative text from the UN on the interpretation of Article 24. Moving on to Article 4 of the UNCRC, essentially that requires states parties to implement Article 24 to the maximum extent of their available resources. So when one reads Article 24 in conjunction with Article 4, there has to be that there's a realistic acceptance that lack of resources, whether financial or otherwise, can hamper the full implementation of those rights that are provided under the CRC. But I think it's just important that the members are aware that it imposes an obligation to move as effectively or as expeditiously and effectively as possible towards the goal. But there's no overt express requirement that there's universal access for children to healthcare for free. The obligation is to move towards the implementation of the goals in Article 24 as expeditiously and effectively as possible. And I thought it was important that members are aware that that's a slightly more nuanced position of the CRC than I caught some members putting forward. I do hope that's helpful to the Assembly. It is intended in that way.
Thank you, Mr. Attorney. Deputy Sutherland, are you asking a question of the Attorney, or do you wish to speak?
Yes, sir, I wish to ask a question of the Attorney.
Please do.
Yeah, it's just that it is the net result of combining Article 24 with Article 4. Is it permissive? So there's nothing there that's stopping you adopting your own unique way of delivering what the aim is. Is it permissive?
Agreed, it is permissive, Deputy.
So it doesn't stop anybody from doing anything, saying this way, we will do this, and this will enable that.
That's agreed, Deputy. The requirement is to move as expeditiously and effectively as possible towards the goal. And there is obviously a margin of appreciation for states as to how they do that, because states obviously will be in very, very different situations as regards their societies as a whole, their economic resources. But I just thought it was important for members to be aware that there's no automatic right that Article 24 of the UNCRC automatically transfers into a requirement to have free healthcare for children on a universal basis now. And we wouldn't be in breach of Article 24 of the CRC if we didn't do that now. The requirement is to move as expeditiously and effectively as possible. I hope that intervention is helpful.
Very much. Deputy Tadley, do you have a further question for the Attorney?
Yes, so it's purely for information, so there's no disrespect in this question. Can I just ask, though, was the Attorney General responding to a question that he'd received from a member, maybe by email, or was he volunteering the information, which I think was helpful to members anyway?
No, I'm happy to reply to that, Deputy. I was volunteering the information myself. I was not responding to any question from members. Normally, I confine myself to answering questions from members, but when I think that an intervention may be helpful to members, I do occasionally offer my advice unsolicited.
Thank you very much, Mr. Attorney. Deputy Kovac.
Thank you, sir. So just to follow to what was said now on Teams, actually, I think the reference to that commitment was made as a general point that every child has the right to access to healthcare. And what we're debating here is actually that many children won't have access due to financial impediment. And every child, we can't say a child is rich. A child in its own right is dependent on their carers, which some can not have any carers. Some would fall out with their carers. Some would be embarrassed to go to their carers whenever they have a health need. Not to mention that on their own right, they'll never have the finances to go there. So what I'm hearing here, even from Deputy Gersten, I'm surprised, it's actually saying that would be all right if this amendment will come from the ministers, but not if it's coming from the backbenchers. Even if it comes at 800,000 estimate that would cost for 17,500 children, and let's say that's wrong and would be double the figure, as the Chief Minister said, out of the 86 million fund, from where just a couple debates before, they were ready to take 12.5 million out and then 7 point something out, to say that that would be too much or need further review, which everyone knows that every child should, and we agree that should have free access or access to healthcare. I really don't understand what further review we need to agree on that. Just because it's coming from the backbenchers, we need to postpone it a bit further to have further reviews. That's all I have to say. Thank you.
Thank you very much, Deputy. Does any other member wish to speak on the amendment? Deputy Stevenson.
Thank you, sir. On the back of that, I've got a really radical suggestion for us. How about those who have these really passionate interests in this area, the deputy who's proposed this amendment and the scrutiny panel and the ministers with this on their agenda and the promises for next year, get together, sit round a table and work something out that is going to be the best for all of us in this island, for the children that we are talking about here. And really, that's all I want to say. Thank you.
Deputy Wilson.
Thank you, sir. I don't want to repeat what everybody else has said, in particular the comments made by the Social Security Minister, but the comment about every child needs access, I absolutely agree. Appointments should be easy to access, and ministers really do welcome the attention brought to this agenda. But I just want to raise an element of caution here, because when we're talking about raising access, we're talking about increasing demand. And we simply do not have any sense of what the demand might be until we do the proper work on this. One of the aspects that we do need to be mindful of is that if that demand increases, GPs will be overwhelmed. And in actual fact, children will not have access in a planned and organised way. So this is not a bar to change, but I think it's picking up something that Deputy Stevens just talked about, which is we actually need to work together on this so that we don't disappoint children, we don't raise their expectations, and we don't put a system in that's actually going to fail them. And it's on that basis, sir, that I propose to reject this proposition.
Any other member wish to speak? Deputy Hegarah.
Thank you, sir. I'm now really concerned. We've just got a health minister that says that there might be an over-expectation that there'll be too many people wanting to go to a GP. Now, correct me if I'm wrong, most young people, all adults, will not go to a GP unless it's needed. And initially, I did have reservations about this and people being able to pay, because I'm lucky I can afford to pay for my child to go to a GP. But what really made me think this afternoon was the fact that not all children or young people would want their parent or have to seek authority from a parent to pay for that visit. And that's why it's turned for me. But also, I think we're all aware that we say put children first and that we want to be as close as possible to being compliant with the UNCRC. And from my perspective, I'm going with it. I can't do anything else.
Does any other member wish to speak on the amendment? If no other member wishes to speak, then I close the debate and call upon Deputy Alves to respond.
Thank you, sir. And I'd like to thank everybody that spoke. I think it's been quite a useful debate and insightful as well. Quite a few minutes. I know a lot of the things that were raised have been, there's been some kind of common themes here, and other people have addressed concerns that other members may have raised. But I think the main one and the main thing that I was disappointed about was, and Deputy Mezek addressed this quite well, was the contribution from the Social Security Minister, because it did feel like actually my speech wasn't listened to. And I think ultimately Deputy Lehegeras just mentioned as well about children having access without the need going to their parent. I think there's one thing here that we haven't mentioned, which is actually those children who are potentially being abused. You know, abuse does not discriminate. Nobody knows what goes on behind closed doors. I was a teacher for 7 years, and before that I was a teaching assistant, and I had numerous children disclosed to me. And that was very difficult, and obviously I had to pass that on. But those children were from a variety of economic situations. None of us know what's really going on in a child's life. And if their only way of getting help is them reaching out to a GP, and yet they can't do that, what right do we have to stop them? So I think I'd actually like to ask the Social Security Minister to maybe go into schools, to maybe speak to social workers, to maybe speak to safeguarding leads, and to see what actually is happening in our island. We may not like to talk about it, but it's happening. Every single day it happens. And so this is potentially, you know, another option for those children to be able to get out of a situation, or to get some help and support in a situation where they wouldn't normally be able to. Now, there's been quite a lot comments from government about the funding. Maybe this is a massive underestimate. Okay, well, what if it's actually an overestimate? Because we don't actually know. And actually, one of the things that we haven't spoken about is private healthcare. According to the Jersey Opinions Lifestyle Survey report of 2018, unfortunately this question wasn't asked in this year's, where it asked about private medical care, over a third, that's 37% of adults, said they were covered by private health insurance, either in their own name or through another household member. So in a number of these cases, this would also include the children of that household. We don't have the numbers, but actually, what's to say that 800,000 may actually be an underestimate? Because that's something we never hear. We never hear that actually what we're saying, or what we're proposing, or what backbenchers are proposing, maybe there'll be money left over. I'd like to thank those members that spoke in support. And I'd like to just address another thing that we talked about with, I think it was the Chief Minister, spoke about, again, this being an underestimate. GPs will have the option here to maybe, I think it was Deputy Dublé that mentioned, have nurse-led clinics instead. You know, if the money is there, then they have the options. That doesn't mean that we are necessarily going to be, or they are necessarily going to be utilising just GP time. They do have the option to use nurses. And also, there's actually no time frame associated with this amendment. You know, this could go, you know, I think it was the Chief Minister was talking about doing some planning around this. Well, that's fine. If it takes 4 months, you know, if it takes the first quarter of next year, if it takes 6 months, so be it. But at least the funding is there and secured and available, because otherwise it isn't. I'm going to actually read out the Article 24 in its entirety. I thank the AG for his contribution, and I think Deputy Kovac addressed it quite well. At the end of the day, so we are one of the wealthiest places to sign up to this, and we should be setting an example. And I think it's important that people understand that being a child, anything that's associated with a fee causes a barrier. It's as simple as that. And the particular parts that I want to draw people's attention to in the article is where it says that it states, parties shall strive to ensure that no child is deprived of his or her right to access such healthcare services. it also says, states parties shall take all effective and appropriate measures with a view to abolishing traditional practices prejudicial to the health of children. If that means it's a fee, it's a fee. If we are more than capable of doing that, we should do it. We should be leading by example. So, sir, I won't go on anymore, but I will say that I hope that members will think very carefully about this and the real life impact and the real difference that this can have on children in the very near future. So, sir, I maintain the amendment and I call for the appel.
That is called for. I invite members to return to their seats. And I ask the greffier to open the voting. If members have had the opportunity of casting their votes, then I ask the greffier to close the voting. I can announce that the amendment has been... wait, sorry. Oh. I apologise.
So just for the avoidance of doubt, when I pressed my button, it went to A when I went to vote for Cont. Yes, it was an abstention, but it was supposed to be Cont, and I'm sorry, I just had a constituent that wanted to see me urgently.
Well, I'm sorry. As we know from the Millennium Park debate, I'm afraid once...
It wasn't the Lever Arch file, so
no,
I'm sorry.
It wasn't, but if someone has not recorded their vote...
So a point of order, I mean, I don't know, it wouldn't be in film, but you'd said it was closed before Deputy Joseph had pressed the button anyway. It's academic.
Well, as it happens, it makes no difference. The proposition has been adopted. 24 votes pour, 22 votes contre, 1 abstention.
I'd like to thank members for their support.
Sorry.
Did you want to say something?
No, it's just my vote would have been Cont, that's all.
Yes, but then it would have been 24-23 and it still would have passed. Yes?
So which way round, sorry?
Do you want those voting pour or those voting contre? Both.
Okay. Those voting pour the connétables of St Heliot, St Lawrence, Trinity, St Martin, St John, Grouville, St Juan, deputies Southern, Tadier, Luce, Lehegara, Ward, Alves, Gardner, Farnham, Mezek, Coles, Horay, Curtis, Faltham, Churn and Kovac. And in the chat, Deputy Lewis and Deputy Doublé. And those voting contre, connétables of St Brelard and St Peter and St Mary, Deputies Ayer, Gorst, Moore, Scott, Renouf, Miller, Howell, Ferry, Curtis, Ward, Wilson, Stevenson and Andrews. And in the chat, Deputies Balash, Morel, Miles, Rose Binet and Tom Binet.
Well, the next amendment listed in the running order is Amendment 12, Jersey Business, lodged by Deputy Scott, The main respondent is the Minister for Economic Development, Tourism, Sport and Culture. And I ask the greffier to read the amendment.
Page 2, paragraph E. After the words summary tables 5.1 and 2 of the report, insert the words, except that in summary table 5.1, the heads of expenditure for the Department for the Economy shall be reduced by 700,000 on the basis that new revenue expenditure growth will not be allocated to Jersey business in 2023.
Scott.
Thank you, sir. Well, I'm actually, even though I voted against the last amendment, actually quite glad it got through. But we now need to find 800,000. And this is the only amendment that intends to save taxpayers' money rather than spend it, ring-fence it, or to tax islanders even more. It doesn't quite save 800,000, but it's 700,000. We're close. But this amendment also offers states members an opportunity to demonstrate leadership, responding to the concerns expressed by many voters regarding sustainable public spending and recognising a trend in economic management that has actually harmed the island's economy, while diverting funds, public funds, away from many much-needed services and facilities for islanders. Sir, let me put this trend of the way in which our economy has been managed, with the help of government, in context. In the last 20 years, the world's economy trebled, and the economies of OECD countries doubled, including mature economies like Switzerland, St Kitts and Nevis. I'm going to chuck in some islands there for you. Within the same period of 20 years, Jersey's economy has reduced in dollar value from $6.5 billion to $5.5 billion. And this is the result of inputs, or we might say expenses, exceeding outputs within the business-generating part of Jersey's economy. And generally, we've got to start thinking about inputs and outputs when we are talking about sustainable spending and a sustainable economy. My proposition does not seek to deprive Jersey business of funding altogether. It simply proposes to cease the continuation of additional funding granted to Jersey business to assist local businesses who were suffering from lockdown and trading restrictions during the pandemic. And this ceasing might have been expected once the restrictions were over. Instead, the Minister for Economic Development is seeking to continue that funding, close to doubling the base grant of $860,000 already provided to Jersey business out of taxpayers' money by adding a further $700,000 annually to that amount. Let us be clear, sir. We are not talking about numbers that come from nowhere. The proposed additional annual funding of $700,000 requires the generation somewhere in our community of taxable business profits of $3.5 billion per year. And if the total proposed annual funding of Jersey business is to be justified by new business activity that Jersey business itself generates, that would need to be £10 million every year, which is to produce a return on investment of close to 200%. I bet we all wish we could get money, a return on that, like on our savings and investments. That hasn't happened, which hasn't been a concern for Jersey business to date. Despite increased GVA being a stated performance measure for economy and skills in the Common Strategic Policy that we've approved, Jersey business is not required by government to show that the work it does has any positive impact on the economy. The performance measures set by the Minister and his department for Jersey business do not seek a return in terms of economic output, such as increased tax revenue. And the Minister for Economic Development, at least at the time of the hearing of the Economic and International Affairs panel, has given no indication that this will change. It remains open to Jersey business to measure its own contribution towards economic output. Business management is about measuring inputs against outputs after all. After reviewing the business justification case for this funding, and I have reviewed quite a few business cases for the Department of Economy, and despite the Council of Ministers' professed value of transparency, this business plan was supplied to the Economics and International Affairs panel in confidence. So I actually took it upon myself to ask for this evidence personally and directly from the CEO, the outgoing CEO of Jersey Business, and I haven't received it. So now that the pandemic restrictions that affected trading are over, will this extra funding lead to extra growth that will justify it? In other words, new business activity generated by Jersey business of around £10 million every year to generate a return of 200%. This isn't going to happen, and we all know that, or should know that. The Fiscal Policy Panel warned states members last month that the island has virtually full employment, so the achievement of this goal was virtually impossible. This means the effect of the proposed funding is most likely to have a negative effect on overall island productivity. So why would anyone advising a council of ministers who are aspiring to achieve sustainable economic growth and sustainable government spending even suggest it? Jersey businesses' own figures show it having advised a very small percentage of the island's businesses. I have no doubt those who have used its services appreciate the free advice offered it at the expense of the taxpayer. Most say they do. But it is not the only service that gives free advice to businesses. The Business Hub of Government's Customer and Local Services team also provides advice on starting and ending a business, running a business, or staff recruitment, and is well spoken of within the island's business community. There also are plenty of businesses in the private sector who offer the same type of service, perhaps seeking to grow in an environment of fair competition, and despite a lack of staff. Unlike Jersey business, many of these are regulated or have to adhere to the code of a professional body and are required to carry some form of professional indemnity insurance. And unlike Jersey business, many of these pay tax. So I have reviewed a number of business documents supporting lines of funding for the Department of Economy, but this is one I could not support. The government plan, as currently drafted, is proposing that taxpayers' funds should be used to enable Jersey business to avoid changing its organisation or letting go of the talented staff it recruited during the pandemic. This without any cost-benefit analysis, which I know is of particular importance to my colleague Deputy Felton. This at a time when thriving growth and tax-paying businesses in the private sector are crying out for talent and cannot increase their growth owing to a lack of staff. States members may wish to remember that Jersey Business is an organisation that seeks to advise commercial startups and entities, most of whom don't have the benefit of government grants, on how to be more productive with less. Its composition has changed already. It announced a new CEO only 2 weeks ago, and this new business leader has an opportunity to demonstrate the very skills which this organisation proposes to teach others in our community, albeit with taxpayers' money, by leading through example. If it is government's intention that Jersey business should have a leading role in helping to address legacy economic issues, such as low productivity, workplace skills, and financial resilience in the current economic and business environment, I suggest government gives this new leader an opportunity to publish a meaningful business plan before additional funding is given, so that states members can be assured any requested further funding is judicious. This business plan should have the stated objective of improving economic productivity using meaningful targets and performance measures in terms of economic output. Jersey business should be requested to produce reports that can demonstrate direct contribution towards economic growth. Sir, we have a responsibility towards the electorate. Whether or not states members vote for this amendment, I, for one, will not be complicit in supporting a budget in which a part of government is allowed to continue to tip money into a bottomless pit while broadcasting the need for economic sustainability and sustainability in government spending.
Is the proposition seconded? Yes. Does any member wish to speak on the proposition? I'd like to turn your light off, Deputy Scott. Any member wish to speak on the proposition? Deputy Catherine Curtis.
Thank you, sir. Deputy Scott argues against the new revenue expenditure growth for Jersey business. I'm surprised at this. The need to diversify our economy requires a business support service. Now more than ever, there needs to be a focus on supporting varied business growth. We have learned through recent international events that we must prioritise security in our economy, and that means assisting entrepreneurs to create new income-generating businesses of many different types, all while supporting our finance industry and our traditional industries. To do this, we need a well-funded business advice and support service. My own experience of the Jersey Business Organisation is one of confidential and expert advice provided unconditionally. In my case, the support offered helped me and my shareholders to develop a business which created work for many other local businesses, such as graphic designers, photographers, website builders, and our own employees. Now is exactly the right time to support business, and the Jersey Business Organisation is well placed to do so. Therefore, I urge members to vote against this amendment. Thank you.
Very much, Deputy. Colin Tarbert, St John.
Thank you, sir. Sir, members who know my background will not be surprised that I'll be not supporting the Deputy's amendment. Prior to being elected, I was non-executive director and chair of Jersey Business, so I'm able to speak from a position of some knowledge when addressing this subject. So I'd like to start by acknowledging the team's excellent work throughout the COVID period. I was proud to be chair of the team at the start of that process, and I've continued to watch as a keen observer throughout. We often talk about the need for a more diverse economy on the island. So Jersey Business provides services for all sectors, having taken on Jersey Retail a number of years ago and more recently taken on a specialist in hospitality. I know they continue to make good progress also in the marine and rural sectors. Jersey Business, like all organisations, does review its performance and spends time putting together its plans for future years. One of the key jobs that Jersey Business does is to actually ensure prospective business owners don't start a business unless they have all the information they need, rather than starting a business based on a hobby. Sir, I can assure members that the team uses technology well, with tens of thousands of visits to their website. They also have a very good triage service to ensure customers are dealt with efficiently. Prior to COVID, the team did a large amount of work with businesses in assisting them getting ready for COVID. Sir, the board not only publishes its annual report, it also publishes its board meeting minutes. Anyone who reads these will see the board always discusses the benefits of publishing its independent research, something that was included in the last annual report. I'd encourage members who haven't read that report to look at page 13 of the last annual report to see the results of their Net Promoter Score, a score of some 64. So NPS, as Net Promoter Score is known, is commonly used in business, and in terms of scoring, anything above 50 is deemed as great, and anything above 70 is excellent. The company that carries out that independent research for Insight say that it's one of the highest they've experienced in Jersey. Page 11 and 12 of that report is also worth looking at, where there's a table that includes Jersey Business's objectives, what they planned, what they delivered, and the difference that they made, again with some very good results achieved. Page 28 of the EIA report, there are claims from an anonymous submission that Jersey Business doesn't have liability insurance, something repeated by Deputy Scott in her speech. But I'd like to assure members that the Board of Directors, made up of experienced local business people, would always ensure that there's appropriate insurance for the activities carried out, as this is a key activity of their role. Sir, the team have proven their worth, and I believe continue to do so. I've been impressed with the work they've done in the past. I mentioned their work with Brexit and COVID, and as we move into more challenging times, the skilled team in Jersey Business will be more crucial than ever in supporting businesses across all sectors, and particularly some of those smaller businesses that are so vital to our long-term economic prosperity. The Deputy mentioned, I think it's CLS where people get advice. The advice given there, sir, is not technical advice, and most of the advice takes them to Jersey Business website and onto technical advice through there. So looking back at the EIA reports, I'm encouraged that the Minister is looking to review the ALOs. Deputy Farnham will recall that when I was chairman, that Jersey Business has always advocated closer working relationships with the other ALOs. There's too much duplication. HR, finance, IT, properties, marketing, the list goes on. Undoubtedly, we could save money from our ALOs if we work with them together. And I'm delighted that a meeting was held recently where all the ALOs attended as a first step to that. Sir, I look forward to seeing the outputs of that ALO review and saving on the overall expenditure. But I will not be supporting the Deputy. I will encourage the Jersey Business team to continue their good work, especially around productivity. Thank you, sir.
Deputy Morrell.
Thank you, sir. Just before we get going as well, I see I'm on the clock, but I'm the main respondent for this, sir, so I believe I probably shouldn't be timed for that. Is that correct, sir?
Yes, you are the main responder for it, that's correct.
Thank you. Sir, before I get going to my main speech, I just wanted to correct and clarify a few inaccuracies in the report and also in the speech that we just heard from Deputy Scott. In the report itself, Deputy Scott claims that 20 years ago, Jersey Business was just one person. Jersey Business did not exist 20 years ago, sir. In fact, Jersey Business was created 10 years ago through the merger of two separate organisations, Jersey Business Venture and Jersey Enterprise. She also mentioned that CLS provide a business hub, and she suggests both in the report and in the speech that this duplicates the work of Jersey Business. CLS have quite clearly confirmed to me, sir, that they do not duplicate any of the services that Jersey Business offer, that they have worked with Jersey Business quite clearly to ensure there is clear demarcation between the services that they both provide. So they provide different services to businesses in Jersey, and there is no duplication, sir. I was also intrigued by Deputy Scott's assertion that over the last 20 years, Jersey's economy has fallen from 6.5 billion to 5.5 billion. And she did so, sir, using in dollar terms, which I thought was quite interesting, because over the past 15 years, the value of the pound against the dollar has halved. That in itself will tell you a lot about the value in dollar terms of Jersey's economy. If you measure it in dollars, it will appear less than it would have in pounds, sir, because of the fall of the pound against the dollar. So, sir, I think by starting off on those clarifications, which I do believe need to be made, I also want to state that I'm incredibly pleased to be following Deputy Catherine Curtis and Conatable of St John in both agreeing with them entirely about the excellent work that Jersey Business do and the excellent results that Jersey Business have, which are shown throughout their annual reports. There are very few ALOs that are as transparent and as willing to try to make efficiencies and work as closely to government policy as Jersey Business is, sir. So I think it's incredibly unfortunate that Deputy Scott has brought this, and I believe it's misguided in its intentions. And whilst there was a lot of talk about cost-benefit analyses, I also have to ask where the cost-benefit analysis is for withdrawing this funding and where the benefit, how that will be captured by Deputy Scott. Where does she think that the benefits will come? Because I haven't seen that cost-benefit analysis either, sir. It is really important, sir, to note from the outset that this amendment is not about brand new money, and it is not doubling the funding of Jersey Business, as Deputy Scott has incorrectly stated. This is funding that Jersey Business has received since the outbreak of COVID, and because it has performed so consistently well, delivering services that are extremely well received by Jersey's small and medium businesses, the government believes, and I believe, that at this time of economic difficulty, we want to show support for the engine room of our economy, those small businesses that our friends and family rely on for employment or who work incredibly hard to run. In fact, this funding is £300,000 less than Jersey Business has received over the last 3 years. Now, I know that many members of this Assembly have run their own businesses, and those that have done so know just how incredibly difficult it is. A constant increase in the amount of regulation, shortages of staff, human resource issues, dealing with client work, increasing minimum wages, they make it harder and harder. If you run your own firm, you are likely working a minimum of 80 hours a week, and it is incredibly difficult to lift your head up from the daily grind to work out how you can increase productivity, develop new products and services, or explore new markets, or even sometimes to know when it is best to step away and call it a day. Jersey Business is government's way of delivering the support that these firms need. It is support in the form of advice and wisdom, rather than in the form of handouts. So yes, it is incredibly good value for money. States members should also be aware that should they adopt this proposition, the direct result will be job losses. People who have dedicated their working lives over the past few years to supporting Jersey's economy through 3 tough years and want to continue doing that difficult work will have to be told that whilst the government wants them to continue doing that work, the States Assembly feels that the economy upon which all of our public services are paid for isn't worth it. So let me explain a bit more about the funding. As the Council of Ministers has set out in the comments to this amendment, Jersey Business was provided with extra resources from 2020 onwards to meet the substantial demand in their services due to the COVID pandemic. This funding was on top of its core grant and enabled Jersey Business to support small to medium-sized companies during such a difficult time. The shock of COVID on small businesses in particular left Jersey Business with a vital role in providing direct advice, detailed guides and timely information to help our business community navigate the pandemic. During the course of 2020 alone, Jersey Business held 350 one-to-one support sessions with local businesses. Their guides were downloaded over 20,000 times, and the Jersey Business newsletter received an 8-fold increase in sign-ups. Following this success, Jersey Business received additional funding through 21 and 22 on top of its base grant to enable the support to be built upon as we entered the recovery phase of our COVID pandemic. In 2022, this additional funding amounted to just over £1 million and allowed for services to expand to meet demand as local businesses sought help to protect their cash flow, shape their business and resilience planning, and find new niches to adapt and grow. Sir, the unamended government plan looked to consolidate this improved service, which businesses have found so useful in recent years, by incorporating a part of this additional funding into Jersey Business's core grant, This was set at around £300,000 less than the funding that they received previously. Sir, if successful, this amendment would reduce Jersey business funding for 2023 by a further 45%, 3 weeks before the end of the year. It will reduce its funding at a time when we're asking them to do more than ever before to support businesses and to deliver our island's business support function. Since I've taken office, sir, I've become even more keenly aware of just how important Jersey business is to our island. When I want to reach out to businesses that may be interested in investing in Jersey, I do so via the excellent network that Jersey Business has developed. When I want to understand about export opportunities for our island's firms, I do so via Jersey Business. Government doesn't have the resources to do this directly, as the local economy department is very small. So Jersey Business operates as a high-functioning extension of my department. Like businesses across the island, I also rely on the advice from Jersey Business as I seek to improve the island's productivity and develop our economy into the sustainable, vibrant economy that will carry us all into the future. Jersey Business's important role has been consistently recognised by local companies. Independent surveys, as the Connotab mentioned, by 4Insight, have returned top scores for Jersey Business from across our local business community year after year. These professional surveys receive responses not only from Jersey Business members, but from more than 350 local companies across all sectors. And 4Insight has confirmed that the value of service scores for Jersey Business are amongst the highest of any organisation that it is surveyed. So, sir, I think the reason why Jersey Business is so well regarded by local businesses is because of the dedication of its staff. The industry experts who work for Jersey Business are able to advise businesses from every sector and are often best placed to help new companies navigate their entry into the market. The independence that Jersey Business offers means that the island's businesses feel that they can trust the organisation in a way that they will never trust government. This independence is vital, and government itself can never replicate it. Sir, I gave you some figures just previously about 2020. Now compare those figures to 2022, or in this year, which is not even yet finished. For this year alone, Jersey Business has fielded 669 new inquiries, of which 42% were about starting up a new business. To have this advice, free of charge and confidentially, is invaluable when you're first starting out. And later, I will attest to that. Jersey Business has also been instrumental in helping businesses utilise the Productivity Support Scheme, move towards carbon net zero, and has helped them develop support for our rural economy and our marine economy. Sir, as we know all too well, COVID was not a challenge limited solely to 2020. While the threats to our island's public health are thankfully much diminished, the impact on our economic health is still being felt. There is no vaccine against a tough business outlook and no panacea to replace months of lost revenue or missed opportunities for growth. But with the right help, with access to the right expertise, businesses can insulate themselves from further shocks and find new opportunities to grow. Jersey Business continues to help companies chart a course through the current global economic uncertainty. Again, to give some examples, 2022 has seen around 50% more downloads of Jersey Business's guides when compared to 2019. What's more, Jersey Business has an ongoing and active relationship with nearly 900 businesses in Jersey. The nature of this support varies from business to business, but whether it's helping to make productivity gains, find new markets, or reach the next steps in their growth, Jersey Business is making a real difference to every one of these companies. Sir, we are an island of small businesses, and I know from my own experience how difficult it can be when you're working full-time, week to week, to find the chance to think about how you could improve your productivity or the resilience of your business. Likewise, it can be hard for entrepreneurs wanting to enter a new market to find the expertise they need to navigate that process. This is why Jersey Business's work is so important, and why its advice is vital to help local companies succeed. So, sir, to return to the issue of funding, which I began with, if adopted, this amendment would represent an almost 50% drop in the funding for Jersey Business next year. It's 45% to be more precise. It would necessitate an urgent review of the services provided by Jersey Business and its ability to maintain its current staff, and it would seriously undermine its ability to support local businesses and future businesses to navigate the current economic climate. Neither Deputy Scott's amendment nor the Council of Ministers' comment detail the implications this could have on our wider economy, so it's impossible to know for sure. But I would ask members to think of those hundreds of businesses that have an ongoing demand for this advice. I'd ask members to consider the hundreds of islanders, many of whom are self-employed or looking to start up a business, or who have relied on Jersey Business in recent years and will rely on them next year. They won't have the service to turn to. I can tell you, sir, no one is born with the knowledge of how to start and develop a business. It's an incredibly confusing and quite a scary landscape, where it feels as though everyone else knows more than you. Jersey Business gives all islanders that one-stop shop where they know, no matter what their business, no matter what their idea, they will be listened to and will receive honest, independent advice in return. Believe me, when it was just one person offering this advice 20 years ago, the advice I received wasn't of the standard that is now being provided. The advice today is bespoke. Back then, it was templated. I wasn't helped back then, but today I know I would be. And to think about the message the success of this amendment would send to our business community during a time of economic challenges, it makes me shudder. Because, sir, as someone who has run a small business, I know that debates like this shape the confidence of companies who are facing difficult times ahead. As local businesses navigate the current economic storm, they will be looking to this Assembly for leadership and for support. They want to know that politicians recognise the challenges they face and that we're working to create an environment that will support their livelihoods and that create opportunities for young people to see their careers and their futures here in Jersey. Sir, by voting down this amendment today, the Assembly has the opportunity to demonstrate that it recognises what businesses already know. That even as the masks and lockdowns are behind us, the impacts of the pandemic are still being felt. And I can add into that the impacts of Brexit and the impacts of the Ukraine war, the impacts of supply chain disruptions, the impacts of incredibly high inflation. They are all being felt, and Jersey's businesses need the help and the advice that they can get, provided by an independent organisation that they can trust. Sir, the staff at Jersey Business is working incredibly hard, not only to help companies navigate the continuing impacts of these challenges. I apologise, sir, I just stumbled. But also the latest challenges to supply chains, as I've mentioned, and also dealing with rising interest rates. It is important, sir, that I add, because I know some members are concerned about ALOs and whether they are being appropriately run and appropriately managed. I can assure those members that I have already asked officers, long before this amendment was lodged, to undertake a review of ALOs that operate via funding from my department, with a view to ensuring that they are operating as efficiently as possible and reporting in the most appropriate way forward. This amendment changes nothing with regard to that. That review goes ahead anyway, because it's something that I asked within the first few weeks of being made Minister for Economic Development. Sir, now is not the time to pull the rug from under Jersey Business, nor is it the time to tell hard-working islanders that this Assembly doesn't care about their hard work. So I urge States members, in the strongest possible terms, please reject this amendment. Thank you, sir.
Thank you very much, Deputy. Deputy Felton.
Thank you, sir. I'm very pleased to follow the Minister because he made many points which I agree with in relation to the precarious position that this amendment, if adopted, would put Jersey Business as an organisation in, and also the impact on its staff. For me, as somebody that has spent many years managing grants and relationships with arm's length organisations in another jurisdiction, the very way that we have in front of us some grants to more or less politically agree is problematic. For me, I think the government plan process shouldn't look at particular grants, it should look at outcomes that we would like to fund ministers to achieve, and then enable ministers to achieve those outcomes. Some of those outcomes may well be achieved by arm's length organisations. But to make an 11th hour change to an organisation's funding just weeks before the beginning of the year, I think is quite unfair on any organisation, no matter what you think of that organisation. Where I have sympathy with Deputy Scott is I do feel that in a number of the business cases, in fact, I wouldn't call them business cases in the government plan because they're paragraphs, we don't have enough information to tell us whether it's actually going to have a good benefit for the cost. But that's an issue for a lot of the areas that we're looking at. And to be honest, if I brought amendments for each of the areas I had concern over, we'd be here for a lot longer than a week. So I do find it difficult to understand why Deputy Scott has chosen to single out this particular organisation. I think that many of us agree that there is lots of work to be done to improve grants management and management of arm's length organisations, and we've heard from ministers today that they intend to do that work. As chair of the Public Accounts Committee, I also attended a day that ALOs attended just a couple of weeks ago, and they were given some really good advice. It was a really good workshop about improving their annual reports and accounts. And as chair of Public Accounts Committee, I can say that the subject of the management of arm's length organisations comes up quite regularly in our conversations. And when we look at our work plan, which we're doing in January for this term of office, I am sure that we will be planning in work around the governance structures and management of arm's length organisations and grants. To come back to my original point about this not being the place to discuss specific grants, I think where we need to get to is where we have confidence that grants are being managed appropriately, and where we are setting a budget, and this is what we're doing here now, that if organisations are not meeting their key performance indicators, if they are not meeting the terms of their contracts that they are receiving their grants to deliver, then at that point I would anticipate that officers and ministers would take action. And I would hope that both as an individual member and as chair of PAC, I would be getting around tables with ministers and senior public servants to ensure that that effective grants management process happens for all funded organisations, including Jersey Business. So I won't be supporting this amendment. I don't think it's fair on this particular organisation to single them out. And I also don't think that it's fair to suggest that we should be cutting funding that could mean that people will lose their jobs in a matter of weeks. Thank you.
Thank you very much, Deputy. Does any other member wish to speak on this amendment? Deputy Hull.
I just wanted to say that I seconded Deputy Scott's proposition, and I was happy to do so. But having listened to all the argument in the room this afternoon, it is with regret that I can't support your proposition going forward. And I just wanted to apologise to Deputy Scott, but I think Jersey Business deserves me to vote against the proposition, sir. Thank you.
Thank you very much. Deputy Andrews.
Thank you, sir. Now, I think actually Deputy Scott has approached this, and she does bring forward a very good point that I think is important that we are to discuss, especially in the new year. Because, of course, the Minister has alluded to ALOs will be under review. But there are some concerns, I think, here. Initially, there was 1.9 million in terms of funding to deal with COVID. And, of course, during COVID, our business supply, it was affected, sir. And we really needed to be in a position where we were going to be protecting our businesses. But because Jersey is a very high-cost jurisdiction, it makes it very difficult. If you want to go and see somebody who specialises in businesses across the economy, you have to pay for it. And not everybody is able to afford the fees that are charged. And hence why we have ALOs. And some may question, well, should ALOs exist? And that's for a separate debate, sir. But for me, Jersey Business did a fantastic job. They protected our business supply, businesses that potentially could have gone under. And I did ask a question of a minister in one hearing on my EIA panel. And I asked him, without Jersey Business, would we see businesses go under? And he said, yes, we would absolutely have seen businesses go under. So I think that was a really compelling point that really has to be made. Because how many of those businesses would have gone under and how many jobs would have been lost? I'd imagine a considerable amount. Now, as mentioned by the Minister, there are several details that maybe lack veracity. However, it has to be said that Deputy Scott has done a pretty good job in actually compiling the amendment. But, sir, when I spoke to a member of Jersey Business, when I attended a meeting, and it was actually for the Controller and Auditor General, and there's a number of ALOs there, and I happened to know the person, so they approached me, and they knew that I was a member of the panel that were actually reviewing the government plan and also Jersey Business. And they approached me and they broached the subject of Jersey Business. And they said to me that they were very concerned. Very concerned because actually they would be losing half of their payroll expenditure. Now, we also have to recognise as well, there are quarterly meetings between the Minister, the Minister's officers, and Jersey Business. Now, from those meetings, we are looking at what has been discussed in terms of demand for Jersey Business's services. So there has actually been a reduced level of funding from 1.9 million down to about 1.5 million. And the reason being is because actually there is still the demand for their services. But absolutely, I do agree that yes, we do need additional information. We need data. And that is across the government. And I think that is something potentially, as a panel, we could maybe be looking into, and that is the Economic and International Affairs panel. But however, to be reducing funds, especially at this time of year, I don't think that is conscionable at all. And I also have to say as well, sir, reduce the funding, and you reduce half the services, and people will be turning up at Jersey Business saying, I want help in this area. What are Jersey Business going to turn around and say? Well, I'm sorry, but we've cut half of our payroll. I'm sorry, I can't help you there. So we are reducing half of the roles, half of the specialisation that is on offer for islanders. And I don't think that is acceptable, sir. And I think internally, we did not actually sit down, the three of us, and speak about Jersey Business thoroughly enough. Yes, there's a disagreement, as should be the case. But I think there could have been a different approach. And I don't think there was a need to bring forward this amendment. I think, yes, we could have potentially brought forward an amendment, but it would have been, how do we increase data that is available to us? And I think that would have been a very proactive approach. I want to be there as a second line of defence. I want to be supporting the Economic Development Minister. He has a tough job since he's come into office. Don't forget, we are dealing with double-digit inflation. Interest rates are increasing. It's becoming more difficult for businesses in terms of the private debt obligations that are made payable. We have to realise that. And as I have alluded to earlier, Jersey is a very expensive place to live. But also, as well, sir, in the amendment, it's mentioned return on investment. And also it's mentioned about corporation tax. Well, yes, there are a few exemptions in terms of businesses who pay tax in Jersey, but indirectly, it is personal income taxation. And also what we have to be looking at is a number of businesses who are using Jersey Business's services, and also looking at the scalability. How many people are Jersey Business assisting where they are scaling their businesses? There is an additional level of output, there is an additional level of income, because those businesses have improved their business efficiencies. And that is the main thing we have to be looking at here, is the quality of services. Now, there are going to be some business models that, yes, it will be very difficult for them to survive. We also have to look at the level of scarcity, for instance, sir, and also the type of sector as well. Because there will be some sectors, despite the specialisation in terms of assistance, they might not be very productive. They might struggle. They might be financially dependent on the government. And that's something that we potentially have to look into as a legislative assembly. But I think there have been several points raised based upon macroeconomics. Now, Jersey business, there has to be a demarcation between macroeconomics and Jersey business. If you're looking at macroeconomics, you'd be looking at, for instance, monetary policy. That's something that, again, excludes us. But fiscal policy is something that, again, is very much concomitant to Jersey. Taxation, government spending. And they are the tools that we have at our disposal. If we want to be increasing productivity in our economy, that's the way how we can do it. We look at, for instance, the fiscal policy report. It's well detailed. However, it's separate from Jersey business. They have been given an allocated level of funding. Their purpose is to actually see a level of input, those who are employed, the level of specialisation that is on offer is actually there to increase the output of businesses. And I think actually Jersey business have done a very good job. And I don't think this is actually sending a good message to ALOs. What do we perceive of ALOs as an assembly? I think there's probably a number of pluralistic discourses in that respect. And that's good and it's healthy. And it's good that we're having this debate. However, sir, I have to say, I fundamentally disagree with us being here and having to discuss this. It's needless, sir. I think there is actually a different and a better way forward, it must be said. And that means, as a panel, in the new year, we can work constructively. Let's support our Economic Development Minister. Don't forget, sir, we have to be more collegiate. We have to work together. We have to get things done. And I want to be that second line of defence. And I want to ensure that actually the staff can be reassured this Christmas they will have their jobs maintained. They will not be going back home having to speak to their loved ones and having to tell them the difficult news that actually they no longer are in employment. Now again, there is an undersupply of labour, and I think this is something that has also been alluded to by the Deputy, that actually people can migrate into the private sector, for instance, where they could take up price taker roles, essentially where they're being profit roles. However, what we also have to be looking at here is if you're going to be reducing the level of inputs in our in Jersey business, then actually you're probably actually going to see less efficiency in the businesses that would be helped otherwise. But because actually you've decided to curtail their funding, those businesses that are maybe potentially inefficient at the moment and could have that transformation where they could become more efficient, that process will not take place because we have directly reduced their headcount. And it doesn't make sense. Now, sir, in an ideal society, would I question the structure of an ALO? Yes, admittedly. And I think we've had discussions, I've had discussions with the Deputy about this. But I don't agree that we should be in this position. It's unfortunate that we are. And, sir, I have to say I will be rejecting the amendment, sir. Thank you.
Thank you very much. Deputy Conetarbison-Brillard.
Thank you, sir. I just want to speak briefly, really, with regard to the structure of the organisation. I've looked at their website and what they do, and I commend what they do in for businesses generally in Jersey. But I do question, sir, having looked at the 2022 results, the amount that the senior executives seem to be taking from the business. And whilst directors are taking, non-executive directors taking a reasonable amount, it just worries me that a large chunk of what is being given to Jersey business is being absorbed into senior salaries. So really, sir, I suppose my point is more a bit of a shot across the bow to Jersey business. Please keep an eye on your costs. We value your input into the business in Jersey, but it can't be at unlimited cost. Thank you, sir.
Thank you very much, Conetard. Does any other member wish to speak on the amendment, 12th amendment? No other member wishes to speak? Then I close the debate and call upon Deputy Scott to respond.
So I would like to thank all the members for their contributions. and I believe that there has been some kind of misapprehension about what I am actually trying to do. I'm not actually trying to attack the Minister for Economic Development. I actually want to support him too. I think that people can be rather naive at times, particularly when it comes to running a business. In that respect, I thank Deputy Curtis, because she relied on advice for Jersey business. She doesn't run a business anymore. The Minister for Economic Development also had a role. You do, sorry. Looked at your site and looked at the site and didn't find it. Okay. We've got some people who actually have run businesses, but and those that are here, I'm surprised that they are, because it actually takes, and I'm not even going to question how much they're putting into the economy right now, but the actual investment that you have to do in terms of time, in terms of knowledge, it's enormous. I know a lot about that. And I got advice, and I do apologise to the Minister for Economic Development when I mentioned the predecessor for Jersey Business being, which was Jersey Enterprise. But let's just come back to that. Okay, so 10 years ago, people started up businesses with the help of that person who manned Jersey Enterprise. 20 years ago, let's go back to those figures about the economy. And why did I use dollar terms? Because that happens to be almost like the general trading currency across the world. But I'm quite happy to use the sterling terms of the performance of the economy over the last 20 years, which it increased. Now let's remember we're comparing it for a world economy that trebled with OECD countries that doubled, St Kitts Nevis doubled. Ours went up in that time from £4.9 billion to £5 billion. And there's a reason for that, and it's economic management. So how many ministers in the Council of Ministers have relied on the assurance of a poorly advised minister? How many former states' assemblies have relied on such assurances that have led to spending decisions that have wasted public money? And whilst I understand, the Deputy Andrews is saying about the message we send to ALOs, I do believe, yes, there's a message that we should send out to ALOs. Business isn't about being personal. Business is about being objective, and I do believe it's when people are saying, well, staff will be leaving before Christmas within a few weeks. How do you know that? Why would it be that way? And if it is that way, how many of you have actually found that when you actually have moved on somewhere else, it's even better? It's like, we're talking about businesses that need support. We have many businesses in this community, thriving businesses that need the support of extra staffing, of funding being put in the right way. And I do want to support the Minister. I actually think that he has got some good initiatives on the go. He's talked about looking at the cutting of red tape, looking at skills gaps. These are all things that businesses would like to have done. But the thing about the skills gap is, again, we have full employment. There are choices that have to be made. Where are people going to go if you've got full employment? There's going to have to be a certain amount of talent mobility. Things are changing in this island, in this economy, and we've got to be realistic about it and stop carrying on doing the same thing as we have been doing, and just allowing our particular economy to carry on being stagnating and shrinking. I mean, let's compare ourselves even with the UK, because I know that often what the UK has done has informed policy in the government. Well, in terms of the last 20 years, its economy increased by 1.8. that factor. You know, we have done abysmally. Now, we have had some new faces in the Council of Ministers, and that may be enough to suggest change to some, but a lot in government hasn't changed. And the Council of Ministers and the States Assembly do need to come to grips with that. When the Chief Minister was chair of the Corporate Scrutiny Panel, as I've said before, Jersey's independent public spending watchdog, the Controller and Auditor General, explained to that panel that much of the reason for dysfunction in government was not knowing what good is, and that often is in terms of choices. And sure, there are pockets of excellence, even within the Department of what was the Economic Development, Tourism, Sport and Culture, now rebranded the Department of Economy. But in the case of challenging the business cases of grant-funded bodies, how much has really changed in the Department of Economy's own culture? I hear the Minister saying he's been relying on Jersey business. Does that include in terms of drafting its own business case for funding? Just maybe. And I hear people saying, well, look, you know, that people have raved about this business. And they, of course, yeah, you've got a kind of like free advice. But I can give you examples of people who've actually come to me and actually who've set up their own businesses and actually have said, well, I didn't actually find them so helpful. I went to this business hub. Clearly, and let's remember, it's actually advised a small percentage of businesses within our community. And it's all very well for Deputy Felton to say, oh, well, let's not do any sort of like late, you know, sort of 11th hour changes to the budget. Well, that's a bit rich, isn't it, coming from a Reform member? I've just been spending the last 2 days debating 11th hour budget changes, which, you know, but this is not about just saying, right, let's find more money. This is about let's have proper justification before we actually give it away, more of taxpayers' money. Now, 5 years ago, the Controller and Auditor General reported the need for government departments to improve oversight and accountability of these grant-funded organisations, such as Jersey Business. And as the Constable of St Brelade's mentioned, she also did a review of the amounts of salaries of their CEOs as well, which did cause a bit of a squeal amongst some. And she gave the department a special mention, the Department of Economy, that is, a special mention regarding its flaws in its oversight of arm's-length organisations in monitoring their performance and developing policy with them. And earlier this year, the government's tracker of the Controller's recommendations showed the Department of the Economy had yet to implement those assigned to it. And in yet another delegation of responsibility, collecting information about the cost and oversight of ALOs was assigned to the Central Policy Department, also known as SPPP. So, the Minister for Economic Development has confirmed to Scrutiny's Economics and International Affairs panel that this value of money work has yet to be done. So how can the Minister now vouch, because words come cheap, don't they? But funding doesn't. Words come cheap. How can he vouch that there is justification for almost doubling the funding that Jersey Business had before the pandemic, now that the lockdown restrictions are over and that businesses can trade better? In the absence of this review for value for money, with the customer and local services running its own business hub to help businesses, and with Jersey's fiscal policy panel having advised states members only last month that additional government spending poses a risk to the future sustainability of government and that it would be prudent to reduce growth expenditure in the early years of the government plan to strengthen reserves which may be required in future years. Well, we've done a lot of good there, haven't we, so far? Now, I do regret the fact that even though I shared, and let's face it, the scrutiny had a very short time to look at and investigate all these business cases. And I did actually, normally I find I have meetings with ministers and we talk about this. None was offered to me by the Minister or the Department for the Economy. The CEOs of Jersey Business didn't contact me. And I wonder why. Because they didn't want to argue with me, I guess. Well, am I that unreasonable? Can I not be convinced by proper facts and figures? How many of the Council of Ministers' amendments have I been supporting on the basis of, okay, I think that is reasonable financial management? So, I guess I've had lots of kind of grand terms here, you know, the excellent network of business opportunity, contacts and things of Jersey Business. Maybe, but I want to see, everybody wants to see results, proper results that actually hit the bottom line, because we come back down to what is business management. And I've also been asked, well, you know, what else, how else might I address this issue? I'm being a problem. I'm not coming up with an alternative. Well, actually, I have given an alternative already. Give the new CEO of Jersey Business a chance to actually show what he can do, rather than just give money right now without even having had the value for money review. This is the Department for the Economy. If there's one thing it might spend £700,000 on, it's actually on learning a meaningful business plan and how a meaningful business plan should be constructed. And maybe ministers could benefit from that too. Or maybe on improving data and analytics with the Chief Economic Advisor, who has actually got a lot of work to do. And maybe that could be looking at getting our heads out the sand, actually understanding how some economies who have been in our position, which is even worse than the UK's, which is the worst performing country in the OECD and in the G20, how to get out of this particular problem that we have as we keep shrinking our economy in dollar terms, but not actually really growing it in sterling terms, whilst we keep depleting reserves. At the end of the day, cases for public spending that purport to assist the economy need to be supported by good evidence, including regarding inputs and outputs, and predicted impact on the bottom line. Now, I have been known to withdraw a proposition if I believe that there is more to be investigated, if it needs to be changed in some way, or if the time is not right for it. But if there's one part of the electorate who cares about having a thriving economy, enough to bend my ear, it's Jersey's business community. I've been a part of it in more than one way. And they understand market forces and respond to them. And that more so than government has in the last 20 years. So it is time for states members to draw the line, to stop feeding a habit, just as we have. We talked about the sweet shop. We talked about the way that we just think this is numbers. But here's just to suffice it to say, nobody in the business door has been in the business community has been beating down my door to withdraw this proposition. And in fact, quite the reverse. So I urge members to support it and very much respect your choices.
You ask for the appel, Deputy. That is called for. I invite members to return to their seats. The vote is on the 12th Amendment. And I ask the greffier to open the voting. Members have had the opportunity of casting their votes. Then I ask the greffier to close the voting. The amendment has been defeated. 3 votes pour, 43 votes contre, no abstentions.
May we have the floor, please, sir?
Those voting for the Conotop of St Bralard, Deputy Scott and Deputy Doublé.
Very well. Is the adjournment proposed?
Sir.
Very well. The Assembly stands adjourned until 5:50 tomorrow morning.